Welcome to Hellgate Gas Products CGMP training. During this training, we will review many of the parts of Chapter 21 in the Code of Federal Regulations. A little bit of history. The Food and Drug Administration was set up in 1936. From 1936 to present, there have been many changes in the rules and regulations as they pertain to the pharmaceutical industry. Also during that period of time, the Food and Drug Administration recognized that some compressed gases are also used in the mitigation or treatment of diseases or illnesses. Because of this, they have been classified as well as drugs. Now, during that process, there were a lot of changes that had to be made and things that had to be recognized that were completely different in the compressed gas business from the pharmaceutical business. For example, we can use labels on our cylinders more than once. The pharmaceutical industry cannot. We can use containers for our drug products more than once. The pharmaceutical industry cannot. We're going to review a detailed look at the CGMP's current good manufacturing practices and how they apply to Hellgate Gas Products in our medical gas operations. You'll find a complete listing, and we will review some of these, for the current good manufacturing practice regulations in Chapter 21, Code of Federal Regulations, Part 210 and 211. There are other related regulations that are also found in Chapter 21 of the Code, specifically Parts 11, 201, 205, 207, and 310. There are different guidance documents. There is a draft guidance for current good manufacturing practices for medical gases. There was an old compressed medical gas guideline, and there is also an older version of the fresh air / gas watt. To begin with, we're going to start from the very beginning, which is the section Part 11 of Chapter 21, the Code of Federal Regulations. Now this particular chapter, or part if you will, refers to the electronic records, the electronic signatures for completing all the records that are required to maintain the history of the manufactured product. Section 11.1 is the scope. Now in the scope, the regulation in this part sets forth the criteria under which the agency considers electronic records or electronic signatures, handwritten signatures executed in electronic records, to be trustworthy, reliable, and generally equivalent to paper records and handwritten signatures executed on paper. This part applies to records in electronic form that are created, modified, maintained, archived, retrieved, or transmitted under any records requirements set forth in agency regulations. The implementation is one that is working its way towards the compressed gas manufacturing facilities. Currently, the implementation is on the pharmaceutical end of things. But eventually, we will be able to set up our own production records in an electronic format, which will be retrievable and will serve as the complete history of the manufacture of the drug gas products. Part 11.2 deals with the implementation. For our records required to be maintained but not submitted to the agency, persons may use electronic records in lieu of paper records or electronic signatures in lieu of traditional signatures in whole or in part, provided that the requirements of this part are met. Under Part 11.3, there are a number of definitions. The definitions that pertain to us as a medical gas manufacturing facility are: what is a closed system? And this refers to the electronic signatures and records of manufacture. A closed system means that it's an environment in which the system access is controlled by persons who are responsible for the content of the electronic records that are on the system, i.e., your QCU members. Electronic record means any combination of text, graphics, data, audio, pictorial, or other information, representation in digital form that is created, modified, maintained, archived, retrieved, or distributed by a computer system. What are some of the controls for the closed system? By definition, a closed system is the environment in which a system access is controlled, which means that not everyone has access, not everyone can change the data that is on the system. The controls for the open system means that anybody that has access to that system can change or modify the electronic data that's there. It is not the best of all worlds because you lose your trustworthiness of the system, of the records. Signature manifestations. These are electronic signatures, and they would be linked to the electronic record. You'd be talking about a QCU person that could electronically sign the production log, and that log would be linked to his signature and to the data, the manufacturing data. The electronic signatures have their own set of general requirements. These we won't be getting into at this time because they are still in a state of flux for the gas manufacturing, medical gas manufacturing facilities. Suffice it to say that it would require more than likely a fingerprint as well as a documented signature to ensure that the person that is signing off on the records is truly the person that is supposed to sign off on the records. There would be controls for identification. The identification codes or the identification passwords would be strictly controlled. Again, the electronic portion of this chapter is all pertaining to the pharmaceutical industry at this time. We will be coming under the guidance of this particular chapter within the next few years. Next up is the subchapter C, which deals with drugs, and it deals with the labeling. In Part 201 of the Code of Federal Regulations, it defines a drug or a drug product in finished package form is misbranded if its label does not bear conspicuously the name and place of manufacturer, packer, or distributor. There are numerous requirements for labels. One of the requirements that has just recently changed in 2015 was the Global Harmonization Act. In this particular act, it has been determined that there needs to be a pictogram on the label. There needs to be a certain setup as to what information is on the label and how that information is conveyed. Here are a listing of the general labeling provisions. In section 201.1, it deals with the drugs, the name and place of manufacture, packer, or the distributor. The next section is drugs and devices, national code numbers. Now, with the compressed gas manufacturing, there has not been a code number set up yet. In the pharmaceuticals, yes, they all have code numbers. You can see in section 5, 201.5, drugs, there has to be an adequate direction for use. 206 deals with drugs' misleading statements. You'll see a lot of this in the dietary supplements, how they're guaranteeing that they can help you lose 20 pounds in 20 days or whatever the thing is. If they cannot back that up, that is a misleading statement. And as such, it makes the product misbranded according to the code. In 201.10, statement of ingredients. There needs to be a statement on the label as to the components, the ingredients that are in that drug product. Ours are oxygen, nitrogen, nitrous oxide. That's what we manufacture here. Soon we will be manufacturing USP grade CO2. Again, that will have to have its own label and it will have to meet the labeling requirements. 201.15 deals with the prominence of required label statements. How much information is on the label? Does it all need to be on that label or not? How prominently is it displayed on that label? Can people read the label, or is the printing so small that you need to take a magnifying glass to even begin to read it? You have to have the right information on the label. It has to be legible. There are certain requirements for Spanish language. Again, this does not pertain to the medical gas products. It does pertain to the pharmaceuticals. The last time you went to the drugstore and got your prescription filled, when you opened up the box or the sack, whatever it came in, there is not only the English language instructions, but the Spanish language instructions. In section 17, 201.17, drugs, the location of the expiration date. Currently, the Compressed Gas Association is not under an expiration date. There is no expiration date on medical gases as of this time. That does not mean to say that in the future the Food and Drug Administration may deem it necessary or expedient to include an expiration date to ensure the integrity and strength of the drug product. In section 201.18, they talk about drugs, the significance of control numbers. The control number is the lot code. The lot code represents the total manufacturing history of that particular drug. Take our gases, for example. Take an oxygen cylinder, for example. it has a lot code on it. And we have a specific way of determining how to develop a lot code. But that lot code would be able to tell anybody what day it was manufactured, what facility manufactured it, what rack it came off of, what group it came out of. You could go back to your production logs and you could find out all the information that you needed to find out about that day's production for that day's lot code. Now, in the event that you had to go back for a recall, you would use that lot code to go back to your original receiving report from your vendor who provided you with the bulk product, and you could request the information from your vendor as to what were the manufacturing parameters, what were the results of the tests. So that is a very important section. Number 19 does not deal with us. Number 20 does not deal with us. Number 21 does not deal with us. 22, 23, 24 do not deal with us. Barcode label requirements. That is something that will be coming in the near future. Barcoding will begin to become required on drug products. It's already required on pharmaceuticals. The barcoding works much the same as the lot code. It electronically represents all the information for the manufacturer and distribution of that drug. The next sections deals with labeling requirements for human drug products held by the strategic national stockpiles. Many of the larger cities have stockpiles of medical oxygen. In the Kansas City area, there are 4 different locations where the stockpiles are held. They're all in caves. The reason for the stockpiling is not to drive up prices. The reason for the stockpiling is in the event of a national or local emergency and there were no power, there would be oxygen to assist people that need the oxygen. Labeling requirements for prescription drugs and or insulin. The labeling requirement needs to state the identity. In our particular case, it would be oxygen, USP, nitrogen, NF, nitrous oxide, USP. It would also be, in the very near future, when we manufacture it, it's already required, carbon dioxide, USP. In section 201.51, it's a declaration of net quantity of contents. Net quantity of contents is again found on our lot code label. It is the liters, or in liquid oxygen, liquid nitrogen, and liquid nitrous oxide, it is the pounds that are actually in that vessel. Liters and for your gaseous products are figured at 70 degrees Fahrenheit. So if a cylinder is at 80 degrees or it's at 60 degrees, it's still going to have the same volume, although the pressure may differ. The volume is still there. Statement of dosage. This pertains to your prescriptions. If we sell direct to an end user, to a patient, and we're handling the billing, not for anybody else, but for ourselves, the prescription that the doctor gives to the patient and the patient gives to us must state the dosage. How many liters per minute is that patient supposed to get? The next section on 56, 201.56, is requirements on content and format of labeling for human prescription drug and biological products. We discussed a few minutes ago the requirements for labeling. There is a certain format that has to be followed for the labels in order for the label to pass this test, this requirement. The format must have the manufacturer, distributor, packer, full name, and address. Has to have a statement of contents, oxygen USP, nitrogen NF, etc. It has to have a prescription or precautionary statement. For example, liquid oxygen or liquid nitrogen, liquid nitrous oxide, liquid CO2, all are very, very cold. Liquid CO2, liquid nitrous oxide are not considered cryogenic, but they are extremely cold and will burn people. You will get a burn. On the oxygen and nitrogen, they are considered cryogenic, cryogenic being defined as anything colder than negative 200 degrees Fahrenheit, and they will immediately cause third-degree burns. There are some waivers for the labeling requirements. For example, if your pill bottle, again this goes mostly to the prescription, the pharmaceuticals, if your pill bottle is too small to handle all of the labeling requirements and precautionary statements, as the manufacturer of that prescription drug, you can put in a supplementary document in both English and Spanish that gives you, or gives the patient, excuse me, all the required information, the precautionary information, any other information he may require. We're going to look at the drugs in general. This is in section 205.1. Again, it's under Title 21 of the Code of Federal Regulations. Under 205.1, the scope, this part of the subchapter applies to any person, partnership, corporation, or business firm in a state engaging in the wholesale distribution of human prescription drugs in interstate commerce. The purpose of this part is to implement the Prescription Drug Marketing Act of 1987 by providing minimum standards, terms, and conditions for the licensing by state licensing authorities of persons who engage in wholesale distributions in interstate commerce of prescription drugs. We're going to stop right there for a minute. How the Food and Drug Administration is able to visit our facilities, what gives them that authority? The authority is if your company is engaged in any sort of interstate commerce that applies to medical drugs, gas drugs. Our cylinders are not manufactured in the states we live in. They are manufactured somewhere else and sent across state lines. That's how the Food and Drug Administration has the authority to come in and investigate our facilities to ensure compliance to current good manufacturing practices. We're going to talk a little bit about definitions, 205.3. Definitions, there are a number of them that apply to us. Manufacturer, for one, means anyone who is engaged in manufacturing, preparing, propagating, compounding, processing, packaging, repackaging, or labeling of a prescription drug. The next one that applies is prescription drug, which means any human drug required by federal law or regulation to be dispensed only by prescription, including finished dosage forms and active ingredients. Wholesale distribution. Wholesale distribution means the distribution of prescription drugs to persons other than a consumer. For example, your DME customers. We are wholesaling our product to the DME customer. In 205.5, they speak about the minimum required information for licensure. In 205.4, I skipped one, wholesale drug distributor licensing requirements. Let's take that one first. Every wholesale distributor in a state who engages in wholesale distribution of prescription drugs in interstate commerce must be licensed by the state licensing authority in accordance with this part before engaging in wholesale distribution of prescription drugs in interstate commerce. This basically means that as a manufacturer and distributor of medical gas products, we are required by the individual states that we do business in to be licensed by those states. The state licensing authority shall require the following minimum information from each wholesale drug distributor as part of this licensing. It goes on to say the name, full business address, phone number, all the trade and business names, DBA, doing business as, those addresses, the type of ownership, partnership, corporation, sole proprietorship, etc., and the name and owner or operator of the licensee, including a partnership, corporation, sole proprietorship. It is quite daunting task to get everything in order so that the licensing authority for your particular state or states that you deal in can issue you the license in the least amount of time. In section 205.6, they talk about the minimum qualifications to get your license. The state licensing authority shall consider, at a minimum, the following factors in reviewing the qualification of persons who engage in wholesale distribution of prescription drugs within the state. Any convictions of the applicant under any federal, state, or local law relating to drug samples, wholesale or retail drug distribution, or distribution of a controlled substance. Any felony convictions under federal, state, or local laws. The applicant's past experience in the manufacture or distribution of prescription drugs. The furnishing by the applicant of false or fraudulent material in any application made in connection with manufacturing or distribution. Those are just some of the minimum qualifications. They do a background check to make sure that no one that is a criminal or has a past criminal record that deals with controlled substances is allowed to have a license. 205.7 deals with the personnel. The state licensing authority shall require that personnel employed in the wholesale distribution have appropriate education and/or experience to assume responsibility for positions related to compliance with state licensing requirements. That's one of the reasons why you're going through this CGMP training, so that you will become familiar with many of the requirements that you as a manufacturer or as a QCU person are required to know. Violations and penalties. State licensing laws shall provide for the suspension or revocation of licenses upon conviction of violations of federal, state, or local drug laws or regulations, and may provide for fines, imprisonment, or civil penalties. They don't really mess around too much. If you're caught doing something illegal, you could lose your livelihood as a company and as a person. Minimum requirements for the storage and handling of prescription drugs and for the establishment and maintenance of distribution records. The Food and Drug Administration, along with the states, have quite a few things that they take a look at. For example, facilities. All facilities at which prescription drugs are stored, warehoused, handled, held, offered, marketed, or displayed shall be of a suitable size and construction to facilitate cleaning, maintenance, and proper operation. In this particular section, this particular requirement deals mostly with pharmacies and pharmaceutical manufacturers, but that does not let us off the hook. We as a drug manufacturer need to keep our home clean, which means that along the manufacturing area, there's no debris on the floor. Labels are removed from the floor and the manifolds. Manifolds are kept in good condition, clean. Those are just some of the things. Have adequate storage areas designed to provide adequate lighting, ventilation, temperature, sanitation, humidity, etc. Again, if you're into manufacturing, you want to be able to see what you're doing, so you need to have adequate lighting. Ventilation. You need to have adequate ventilation so that the air doesn't get stale, so that your processors are taken care of. The temperature, not many places have temperature controlled warehouses. Sanitation, however, that is important. Do not let your trash cans overflow onto the floor. Do not let the restrooms become dirty and grimy. Clean them. Equipment. The equipment has to be adequate for the manufacturer. Our equipment is adequate. You also need to have a quarantine area for the storage of prescription drugs that are damaged, misbranded, adulterated. If you have a product that is out of spec, it needs to be moved to a quarantine area and designated out of spec. If you have cylinders that are in the out of hydrotest, there is a quarantine area for hydrotest cylinders. There is also a quarantine area for hold. Hold before release. Product cannot be released until it is reviewed by a QCU member. The product should be put in the quarantine hold. Each outgoing shipment shall be carefully inspected for identity of the prescription drug products and to ensure that there is no delivery of prescription drugs that have been damaged in storage or held under improper conditions. This also refers to we do not ship product that has not been reviewed and released. It has to be reviewed and released before it can be shipped out of our possession. Returned product. In the compressed medical gas facilities, manufacturing facilities, you will get cylinders back from customers, DME customers, hospitals, clinics that still have product in them. It is the position of the FDA and the Compressed Gas Association that there is no such thing as residual product in the manufacture. All the cylinders will be blown down and they will be evacuated. There is an exception to that, and the exception is in your liquid cylinders, liquid oxygen, liquid nitrogen. We may fill right on top of the residual. So if the cylinder comes back, the liquid cylinder comes back, and it has 100 pounds of product left in it, we can hook up the fill line and fill right on top of that 100 pounds to the full weight. Now, how can we do that with liquid, but we can't do it with gas? The answer is very simple. Every liquid cylinder that we manufacture that is a drug product is individually tested. Whereas on the compressed gases, nitrogen USP, or nitrogen NF, oxygen USP, one cylinder per rack is representative of that whole rack. Now, why didn't I include liquid nitrous oxide in this exception? It's not included because we can use one cylinder that has been filled, an E cylinder, to represent the whole production cycle, whether it be high pressures and liquids or just liquids. We would need to fill one high pressure E and use that as your test. Those are some of the minimum requirements for storage and handling. There are a number of other requirements, most of which pertain to the pharmaceuticals. We're going to look at chapter or part 207, subchapter C, which deals with the registration of producers of drugs and listing of drugs in commercial distribution. We won't spend a lot of time with 207 because it deals basically with pharmacies and pharmaceutical companies. There's about 40 pages in section 207 that deals specifically with pharmacies, that deal with pharmaceutical companies. They deal with blood, they deal with bulk drug receipts. So we're going to skip right into section 210. Now, section 210 is the current good manufacturing practice. Everything that we have spoken about previous to this is just background so that you understand how intense the compliance issue is for the Food and Drug Administration and for the individual states. In section 210.1, the status of current good manufacturing practice regulations, The regulations that are set forth in this part and in Part 211 of this chapter contain the minimum current good manufacturing practices for methods to be used in and the facilities or controls to be used for the manufacturing, processing, packaging, or holding of a drug to assure that such drug meets the requirements of the Act as to the safety and has the identity and strength and meets the quality and purity characteristics that it purports or is represented to possess. How it applies to our current good manufacturing practice. The failure to comply with any regulations set forth in this part and in Part 211 of this chapter in the manufacture, processing, packaging, or holding of a drug shall render such drug to be adulterated under Section 501A of the Act, and such drug, as well as the person who is responsible for the failure to comply, shall be subject to regulatory action. So you can see from these two statements, 210.1, 210.2, the Food and Drug Administration is very diligent to ensure that the drugs that are sold are drugs that meet the requirements for identity and strength, and that the facilities meet the requirements, and these are just minimum requirements for the manufacture of a drug product. You're going to hear some terms that I want to define for you. In 210.3, it gives some definitions. For example, a batch is a specific quantity of a drug or other material that is intended to have uniform character and quality within specified limits and is produced according to a single manufacturing order during the same cycle of manufacture. Some of that refers back to the pharmaceutical industry. However, in our particular industry, batch, think of your bulk tank. Batch is your entire contents in your bulk tank. That is your batch. A lot is a portion of that batch. So each rack of oxygen, each rack of nitrogen, each liquid, oxygen or nitrogen, each one will have a different lot number. That's why we increment the lot number. So the first batch, or the first lot of the day is lot 1, the next one is lot 2, etc., etc. Drug product is another definition that I wanted to share. Drug product means a finished dosage form. For example, they're talking about tablets, capsules, solution, finished drug form. Think of it in this manner. It is the cylinder of oxygen or nitrogen or nitrous oxide. It's in its finished form. In-process material is another definition. Means any material fabricated, compounded, blended, or derived by chemical reaction that is produced for and used in the preparation of a drug product. In-process material is the material that we are using to fill. During your process, you are in process. You're taking liquid oxygen from your batch, your bulk tank, and putting it into cylinders. That's an in process. Lot numbers. We discussed that a little bit earlier, but it's important. A lot number is a distinctive combination of letters, numbers, or symbols, or any combination of them, from which the complete history of manufacturing, processing, packaging, holding, and distribution of a lot or a batch of drug product can be determined. Quality Control Unit. You're going to hear an awful lot about that. It's called QCU. We have a number of QCU members. Each branch has at least two. Quality Control Unit means any person or organizational element designated by the firm to be responsible for the duties relating to quality control. We'll get into this in a little bit more depth when you learn about the QCU responsibilities. But suffice it to say, the QCU member is the last set of eyes that goes onto the product before it is shipped. It's the QCU member's responsibility to ensure that all the information on the production logs is accurate and complete. The cylinders are labeled as they are supposed to be labeled, with the product identification label as well as the lot code. When we talk about strength, we're actually talking, in the compressed gas business, we're actually talking about the assay. We don't want to ever say purity, because we do not test for purity. Purity, by definition, would mean that you are going to tell someone not only what is the percentage of the finished product, 99.5 or greater, but also what are all the other elements that are in that. Whether you're filling oxygen cylinders, and if you say I'm giving him purity, what that's saying is, yes, you're giving him oxygen, but you've also identified that there is trace amounts of argon, there's trace amounts of nitrogen, trace amounts of any other of the gases. We use the term assay. Assay is a definitive term that says basically what the strength of our finished drug product is. Our requirements are 99.5% or greater. The FDA's requirements for our drug products are 99.0% or greater. I just have a couple more definitions that I wanted to explain. An acceptance criteria. You'll hear that referred to as, what is our acceptance criteria? What makes a product qualify for the drug product or not? The product specifications and acceptance rejection criteria, such as the acceptable quality level and unacceptable quality level, with an associated sampling plan, that are necessary for making a decision to accept or reject a lot or batch, or any of the other convenient subgroups of the manufactured product. So let's talk about that for just a minute. When we receive our bulk product, when we receive our bulk product from our manufacturer, whether it be Airgas, Praxair, whomever it happens to be, we have a requirement that we test the incoming batch for strength and identity before we can accept it, before we can fill. We don't want to be receiving a non-medical product into our medical bulk tanks. Non-medical product would be, in the example of an oxygen, anything less than 99.0. That's the minimum that the Food and Drug requires. So if we end up with a product that we test out and it comes out to 99.89, we have a major problem. We have to get a hold of the manufacturer and have them look at their last delivery and find out, was it a delivery that was meeting all the criteria. The last definition I wanted to give for subpart 210 is the representative sample. It consists of a number of units that are drawn based on a rational criteria, such as random sampling, and intended to assure that the sample accurately portrays the material being sampled. In our process, when we manufacture oxygen, USP, or nitrogen in cylinders, high pressure now, we take one cylinder from that group or that lot and we test it. We test it for identity, we test it for strength, we test it for odor. That one cylinder represents that entire lot. Part 211 of CFR 21 is the all-encompassing part. It is extremely long. It takes into consideration facilities, personnel, responsibilities, etc. So we're going to go through each section so that you get a better understanding of what the minimum requirements are for the current good manufacturing practices. In 211.1, it states that the regulations in this part contain the minimum current good manufacturing practice for preparation of drug products. The definitions that they give, we can talk about the drug products, we talk about human use, we talk about cells, tissues, cellular applications. A lot of those things do not pertain to us, so I will not spend any time with them. Subpart B, organization and personnel. First one is the responsibility of a quality control unit member. Remember a few slides back, I told you that the quality control unit member had a wide range of responsibilities. I'm just going to give you a few. According to the rule, there shall be a quality control unit that shall have the responsibility and authority to approve or reject all component drug product containers, closures, in-process materials, packaging materials, labeling, and drug products, and the authority to review production records to assure that no errors have occurred, or if errors have occurred, that they have been fully investigated. The quality control unit shall be responsible for approving or rejecting drug products manufactured, processed, packed, or held under contract by another company. Adequate laboratory facilities for the testing and approval or rejection of the components, drug product containers, closures, packaging materials, in-process materials, and drug products shall be available to the quality control unit. The quality control unit shall have the responsibility for approving or rejecting all procedures or specifications impacting on the identity, strength, quality, and purity of the drug product. The responsibilities and procedures applicable to the quality control unit shall be in writing. Such written procedures shall be followed. So as you can see, the QCU member has a lot of authority. He has a lot of responsibility. And when I say he, I'm referring to he or she. It does not make any difference. Adequate laboratory facilities. We have to have those in order to properly test and identify the product that we are filling. We talked about the ability to reject batch product. Also has the ability to reject lots. If for some reason the lot does not pass the quality controls, then the QCU member can reject that lot. Personnel qualifications. Each person engaged in the manufacture, processing, packing, or holding of a drug product shall have education, training, and experience, or any combination thereof, to enable that person to perform the assigned functions. Training shall be in the particular operations that the employee performs and in current good manufacturing practice, including the current good manufacturing practice regulations in this chapter, Chapter 21, and the written procedures required by these regulations as they relate to the employee's functions. Training in CGMP practices shall be conducted by qualified individuals on a continuing basis and with sufficient frequency to assure that employees remain familiar with CGMP requirements applicable to them. Now we get down to the supervisor, which is also still under personnel qualifications. Each person responsible for supervising the manufacture, processing, packing, or holding of a drug product shall have the education, training, and experience, or any combination thereof, to perform assigned functions in such a manner as to provide assurance that the drug product has the safety, identity, strength, quality, and purity that it purports or is represented to possess. That covers the personnel qualifications. Now we'll get into the personnel responsibilities. Personnel engaged in the manufacture, processing, packing, or holding of a drug product shall wear clean clothing appropriate for the duties they perform. We'll stop there for just a second. We don't want somebody on the oxygen line that has greasy blue jeans or greasy gloves performing the filling operations. It does not give the product the quality that it needs to have. Plus, it is very dangerous to have greasy clothing, gloves, while dealing with oxygen. Protective apparel such as head, face, hand, and arm covering shall be worn as necessary to protect drug products from contamination. Again, that portion refers mostly to the pharmaceutical. However, in our particular instance, we want to make sure that our folks are safe. So we do have them wear hand protection, gloves, safety shoes with steel toes. Another responsibility for personnel, they shall practice good sanitation and health habits. Only the personnel authorized by a supervisory personnel shall enter those areas of the building and facilities designated as limited access areas. As a facility manufacturing drug gas products, we do not yet have any limited access facilities. That pertains to the pharmaceutical industry, where you don't want people going from the mixing areas to the packaging areas, or vice versa. Any person shown at any time, either by medical examination or supervisory observation, to have an apparent illness or open lesion that may adversely affect the safety or quality of drug products shall be excluded from direct contact with the components, drug products, containers, closures, in-process materials, and drug products until the condition is corrected or determined by competent medical personnel not to jeopardize the safety and quality of the drug products. What this entails is you don't want someone that is having a flu, a stomach flu, doing the sniff test on the cylinders or handling the cylinders. We would rather have that person home getting well so that they could come back and come to work for us. Consultants, we presently do not have any consultants. There are specific requirements that consultants need to abide by, and we won't get into that at this point. As I said earlier, you can see that this particular chapter, chapter 211, or part 211, excuse me, is very intense. It deals with just about everything in the manufacture of a drug product, whether it be a pharmaceutical or a compressed medical gas. We look at the design and construction for buildings, for example, 2142. Any building or buildings used in the manufacture, processing, packing, or holding of the drug product shall be of suitable size, construction, and location to facilitate cleaning, maintenance, and proper operations. We want to make sure that our buildings, however large or small they are kept in good repair. We want to make sure that cylinders are where they are supposed to be. They are sectioned off, cordoned off. Quarantine cylinders are separated from good product, released for distribution product. Industrial cylinders separated from medical gas cylinders. All that helps in the utilization or optimization of your floor space. That goes right along with the next section that deals with the design and construction. Adequate space for orderly placement of equipment and materials to prevent mix-ups between different components, drug product containers, closures, labeling. Also deals with the flow of the components, the drug product containers, closures, labeling. So again, segregation of your products. You need to have enough space where you can keep things orderly so if somebody is not grabbing a industrial nitrogen as a medical nitrogen or an industrial oxygen as a medical oxygen. Holding rejected components, there needs to be an area for holding the rejected drug product components. If you have cylinders that have been contaminated by blood, for example, came back from a ambulance, those cylinders need to be quarantined and they need to be cleaned before they can be put back on the rack for filling. You need to have a storage for released components. So again, you've got a hold for review and release. You've got a quarantine, whether it be for hydrotest or maintenance or something else. Now you need a storage area for the release of the components, where after they have been reviewed, they are moved to the released for distribution area. Under 211.44, they talk about lighting. And in the section, it says adequate lighting shall be provided in all areas. Well, let's take a look at that. We know we have to have adequate lighting. It's a requirement. But does adequate lighting mean that if you have a 2-bulb fluorescent system and one of the bulbs is out, that's adequate? No, it's not. If you have bulbs that are out, replace them. If you have units that aren't working, replace them. Ventilation, air filtration, air heating, and cooling. That deals specifically with the pharmaceutical end of the manufacturer. It deals with keeping the air systems, air handling systems, when they're using air to push product through, making sure that that air is clean. Air filtration systems. Plumbing, we'll skip down to that one. Potable water, drinkable water, shall be supplied under continuous positive pressure in a plumbing system free of defects. So we want to make sure that we have adequate water in our facilities for our personnel to drink and wash up with. Sewage, trash, other refuse in and from the building and immediate premises shall be disposed of. Well, that just goes without saying. Washing and toilet facilities, adequate washing facilities shall be provided, including hot and cold water, soap or detergent, single-service towels, clean toilet facilities easily accessible to working areas. Any building used in the manufacture, the processing, packaging, or holding of the drug product shall be maintained in a clean and sanitary condition. Any such building shall be free of infestation by rodents, birds, insects, or other vermin. Trash and organic waste matter shall be held and disposed of in a timely manner. All this deals with the sanitation. It deals with making sure that our facilities are clean. I addressed that earlier. If there's paper on the floor, boxes on the floor, throw them away. Pick them up and throw them away. The reason you want to do that is not only for the cleanliness, but it can be a trip hazard. And we don't want people tripping just because they didn't bend down to pick up a box or a scraper or pen or pencil that's on the floor. Next up is Subpart D, which deals with the equipment. It's not a real long section. Matter of fact, it's 3 lines. Equipment used in the manufacture, processing, packaging, or holding of a drug product shall be of appropriate design, adequate size, and suitably located to facilitate operations for its intended use and for its cleaning and maintenance. It goes into the cleaning and maintenance. I skipped over construction specifically because it deals more with the construction of pharmaceutical equipment than it does with manufacturing of compressed gases. We'll look at the cleaning and maintenance. Equipment shall be cleaned, maintained, and as appropriate for the nature of the drug, sanitized or sterilized. Well, we don't do that. At intervals to prevent malfunctions or contaminations that would alter the safety, identity, strength, quality, or purity of the drug product. So my suggestion would be we need to assign responsibility for cleaning and maintaining the equipment. Maintenance and cleaning schedules need to be written and they need to be followed, and it needs to be documented. One point with the Food and Drug Administration and with the different state licensing boards, if it is not written, it did not happen. So if you change out a cold end on the oxygen pump or a yoke on your manifold, that has to be documented. That's one of the requirements. Not only that we do the maintenance, but that we document the maintenance. The next section, 211.68, deals with automatic, mechanical, and electronic equipment. Basically, it's dealing with computers and how they are used in the manufacturing. Sometimes computers can do the job of a human. In our particular instance, that's not the case. But if you remember earlier in section 11 or part 11, when we were talking about the electronic signatures, appropriate controls shall be exercised over computer or related systems to ensure that changes in master production and control records or other records are initiated only by authorized personnel. Input to and output from the computer or related system of formulas or other records or data shall be checked out for accuracy. So again, we get back to the electronic records where we have to have specific controls, passwords, codes, and only authorized personnel are able to get in and change any records. Filters, we don't have any filters to be concerned about. That again is in the air filtration system of pharmaceutical plants to cut down on the dust that may contaminate a drug product. We look now at subpart E, which is a control of components and drug product containers and closures. When you're talking about drug product containers, you're talking about cylinders. When you're talking about closures, you're talking about valves. And drug products components, you would be talking about your batch, your bulk liquid oxygen, liquid nitrogen. There shall be written procedures described in sufficient detail the receipt, identification, storage, handling, sampling, testing, and approval or rejection of components, drug product containers, and closures. Such written procedures shall be followed. We have in our manual the procedure for receiving bulk product, whether it be oxygen USP, nitrogen NF, nitrous oxide USP. We have the procedures for the testing of the initial receipt and the documentation on the batch, the liquid receipt log. The rest of that section deals basically with the receipt of pill containers under the general receipt and storage of untested components, drug product containers and closures. We don't do any tests on the containers other than the hydrostatic test, which is required on aluminum every 5 years, on steel if the test date is followed by a star every 10 years. Testing and approval or rejection of components and closures. Again, same thing holds true. The following sections, 211.86, 87, 89, they're all dealing basically with the pharmaceutical industry in how they accept or reject the plastic containers, the caps, the vials, whatever they're using. They have to have a specific sampling section, and they have to be able to take that sample. It represents the material that they've received and document what the rejection was for. Contaminated, did not conform to drawings, anything of this nature. Container closure systems are the valves. They shall provide adequate protection against foreseeable external factors in storage and use that can cause deterioration or contamination of the drug product. Drug product containers and closures shall be clean and where indicated by this nature of the drug, sterilized, we don't have to do that, and processed to remove pyrogenic properties. Pyrogenic is fire. We don't want to have any oxygen cylinders, any drug cylinders, with any sort of external contamination, i.e. grease, oil. You will see sometimes on the filling line where cylinders come in from nursing homes, even DMEs, where they've used Scotch tape to cover the outlet on the valve. Scotch tape, not just by the brand, but that type of tape is a petroleum-based tape. You do not want to just remove the tape. You have to actually clean the valve to get the petroleum-based product off of there. Otherwise, you run the risk of having a flash fire on your manifold. Could cause serious problems from just burning up a manifold or a pigtail to an explosion to personal injury or death. Production and process controls, written procedures, and the deviations. There shall be written procedures for the production and process control designated to ensure that the drug products have the identity, strength, quality, and purity they purport or are represented to possess. Such procedures shall include all requirements in this subpart. These written procedures, including any changes, shall be drafted, reviewed, and approved by the appropriate organizational units and reviewed and approved by the quality control unit. We have a system in place where we can request changes to the changes to the manual. If there is something in the manual that needs to be changed, if we follow the procedure, it goes up the chain and it is reviewed. And if that change is deemed necessary, the appropriate documentation will be generated and it will be disseminated to the different branches. The rest of this subpart, the calculation of yield, is not a requirement for compressed gases. The equipment identification, we identify our racks, either rack 1, rack 2, 48 cylinder rack, 72 cylinder rack, but we identify it. We identify it as well in our lot code. Sampling and testing of in-process materials and drug products. Again, this is basically pharmaceutical. Time limitations on production. Again, basically pharmaceutical. The reason for that is you don't want a raw drug being exposed to moisture, sunlight, whatever it might react with before it is put into its finished form. Control of microbiological contamination. Again, that's basically pharmaceutical. Reprocessing. In our particular business, the compressed gas business, there is no reprocessing. If we deem a product as out of spec, then that product is not retested numerous times until we can get it correct. We test it 3 times in addition to the original test, and if after the 4th time, including the original test, the product still does not pass, then that whole lot is rejected, which means it is blown down. An investigation needs to be performed to find out what was the root cause for the out-of-spec condition, what were the remedies that were taken to put the product back into spec, and then continue on with the processing. Next is subpart G, which is packaging and label control. First section, 211.122, deals with material examination and usage criteria. There shall be written procedures describing in sufficient detail the receipt, identification, storage, handling, examination, and/or testing of labeling and packaging materials. Such written procedures shall be followed. Labeling and packaging materials shall be representatively sampled and examined or tested upon receipt and before use in packaging or labeling of a drug product. Now, how does that apply to the compressed gas manufacturing? We have written procedures when we receive labels, the exact process and procedure to examine the labels, to accept the labels, to store the labels. We follow those procedures and we document it on the label control log. The records shall be maintained for each shipment received of each different labeling or packaging material indicating receipt, examination or testing, and whether accepted or rejected. Again, that goes back to the receiving of our product labels, the medical drug product labels, where again, we take a look, we follow our procedures, we examine the labels. If the labels are acceptable, the QCU member writes up a notation stating that the labels are acceptable and that they have been put into the label control cabinet. The label control cabinet is a secure cabinet. It's a cabinet that has limited access to, according to our procedures, under labeling issuance, a QCU member will issue the appropriate number of labels that the processor deems he may use during the production day. Along with the labeling, there shall be procedures used to reconcile the quantities of labeling used or issued, used, and returned to the cabinet. So when a processor is issued 100 labels in the morning and he comes back and has 25 labels left over, you need to review the production logs and ensure that 75 labels are accounted for on the production logs. You'll document that on your label control. A QCU person will sign off that he's reviewed that information. Tamper-evident packaging. We don't do over-the-counter human drug products, so that does not apply to us. Drug product inspection. Again, we inspect our drugs as they come in, our medical oxygen, our medical nitrogen. There is a procedure for accepting it. There's a procedure for testing it. And a QCU member will sign off that they did in fact test it and it does in fact meet the requirements for Hellcat gas products. 211.137, expiration dating. Again, the Gas Association is exempt at this time for dating any of their products with an expiration date. Under Subpart H, we look at the holding and distribution. Under the warehousing procedures, it states that written procedures describing the warehousing of a drug product shall be established and followed. They shall include quarantine of drug products before release by the Quality Control Unit member. There shall also be adequate storage of drug products under appropriate conditions of temperature and humidity. Again, that deals with mostly the pharmaceutical, but segregation is another portion of the warehouse procedure. Segregating the customer-owned cylinders from the Helgood-owned cylinders, separating industrial cylinders from medical gas cylinders, i.e. nitrogen, for example, oxygen, for example. Each one of the areas needs to be appropriately marked. If you are having areas for hold, they need to be marked as areas for hold. If you have areas for released for distribution, they need to be marked released for distribution. There has to be adequate signage so that anyone pulling any product from the area knows exactly the status of that product and knows not to pull it from an area that the product is in that says hold for release. Distribution procedures. Written procedures shall be established and followed describing the distribution of drug products. They shall include a procedure whereby the oldest approved stock of drug product is distributed first. Deviation from this requirement is permitted if such deviation is temporary and appropriate. So what that tells us is that we need to ensure that when we put product that has been released into the released area, that our drivers pull from the area of oldest product. Now that's going to be something that the individual warehouses, based upon their facility size, are going to have to set up for themselves. But it's basically the first in, first out inventory control. Also in the distribution, a system by which the distribution of each lot of drug product can be readily determined to facilitate its recall if necessary. What this pertains to is when we deliver our medical drug products to anybody, whether it be a hospital, a clinic, a DME, we document the lot code on the invoice or delivery ticket. That lot code, again, is the entire history of manufacture for that particular drug. It is very, very important that our lot code documentation be accurate. If you are involved in a recall, you need to be able to determine who got those cylinders. And we can determine that through our delivery tickets. However, if you have a rack of cylinders, let's just say your rack is 72, and you have to do a recall on that particular rack, and you come up and find out that you have documentation for 80 cylinders. That means our delivery personnel took basically the easy way out. They looked at a couple of cylinders, assumed a 60-cylinder cart was all one lot code, and this other 24-cylinder cart was all the same lot code, so they wrote it all down as one lot code. Now we haven't followed our own procedures, so doing a recall would be almost impossible. We're looking for more cylinders than we manufactured. Recalls need to, or by law, have to be reported to the Food and Drug Administration. How many cylinders were involved and the recall process in itself. So again, under distribution procedures, the documentation, the accurate documentation of lot codes on the delivery ticket is paramount to being able to adequately perform a recall, if that should ever happen. Laboratory controls. One of the general requirements is laboratory controls shall include the establishment of scientifically sound and appropriate specifications, standards, sampling plans, and test procedures designed to assure that the components and drug products conform to appropriate standards of identity, strength, quality, and purity. In addition, the calibration of instruments, gauges, apparatus, and recording devices at suitable intervals in accordance with an established written program containing a specific directions and schedules, limits for accuracy and precision, and provisions for remedial action in the event accuracy and/or precision limits are not met. Instruments, apparatus, gauges, and recording devices not meeting established specs shall not be used. This is why we go through our annual gauge calibration to ensure that the process gauges that we use for pressure and vacuum are accurate. We want to make sure that everything is accurate, specifically to address the volume that is in the vessel. We don't want to be short filling because that's misbranding. Short filling would be taking a cylinder and filling it to 2000 psi when in fact it should have been filled to 2200 psi. Now 200 psi doesn't sound like an awful lot. However, that's a tenth of the cylinder. So your stated liters that are on your lot code are a tenth off, which makes that cylinder misbranded. You're claiming you have more in the cylinder than you actually do. How did that happen? It happened because your gauge was off by 200 psi. You thought it was 2200. This is why we go through our annual calibration. Vacuum is another calibration. The vacuum gauge has to be accurate to ensure that you are pulling out all of the old product. If you don't get all of the old product out of a cylinder and then put new product in it, your assay will be lower than what it should be. And you may end up having an out of spec situation where your assay is showing up at 99.4 when in fact it should be 99.7, 99.8, but because your vacuum gauge was off and you couldn't pull the appropriate vacuum, you had commingled product basically. The testing and release. For each batch or lot of drug product, there shall be appropriate laboratory determination or satisfactory conformance to final specifications for the drug product, including the identity and strength of each active ingredient prior to release. What that is saying is we will test one cylinder from each lot. That one cylinder will represent the entire lot. We will test it for odor. We will test it for identity. We will test it for strength assay. And that represents the entire lot. Stability testing, that is not a requirement at this time for medical gases. It is a requirement for the pharmaceuticals. The next four sections, 211, 167, 170, 173, 176, as you can see, do not pertain to the compressed gas industry. These pertain specifically to pharmaceuticals and testing laboratories. The next section, Section J, is dealing with records and reports. The general requirement: any production, control, or distribution record that is required to be maintained in compliance with this part and is specifically associated with a batch of a drug product shall be retained for at least 1 year after the expiration date of the batch. Now again, we go back to the fact that gases, medical gases, are exempt from an expiration date. So what we do is we keep the records for 3 years plus the current year. So taking, for example, the year 2015, our saved files should have all of the records for 2015 as well as 2012, 2013, and 2014. Those are the records that we are required to maintain. We are required to maintain those for production, receipt of bulk product, label control, gauge calibration, thermometer calibration, maintenance, any process or procedure that directly or indirectly impacts the manufacture of a drug product. So 3 years plus the current year. All records required under this part, or copies of such records, shall be readily available for authorized inspection during the retention period at the establishment where the activities described in such records occurred. So that means that in the event of an FDA inspection or a Board of Pharmacy, State Board of Pharmacy inspection, and again using 2015 as the current year, they ask for records from 2012. You need to be able to provide the records for 2012. Under 211-182, equipment cleaning and use log. If you remember back in previous conversation, I said that we needed to have a maintenance log for all of our equipment, and we need to document when maintenance is performed. We use the example of a cold end on an oxygen unit or a yoke on a filling manifold. The statute says a written record of major equipment cleaning, maintenance, except routine maintenance such as lubrication or adjustments, and use shall be included in individual equipment logs that show the date, time, product, and lot number of each batch processed. In our particular case, we should have the date that we did the work, what was done, and when it was completed. Earlier, we talked about component, drug product container, closure, and labeling records. Just to review, when we receive bulk product, we have a bulk product receipt log that we complete. Labeling records, we have a process and procedure in place when we receive new drug product labels, how to document those labels as they are inspected, as they came into us, as they are accepted or rejected. We also have records on the daily use of labels. It's called a label log, where labels are issued, they're used in the production during the day. There may or may not be some labels returned. You verify the number of labels used against the number of labels issued. And if that is the appropriate number, then a QCU member can sign off on that log. If it is not the appropriate number, then an investigation needs to occur. What happened to the labels? Why did you use 5 more than you actually took out? Or where are the 5 that you're supposed to have used and they're not here? The master production and control records. Those are your control records for the production of your drug products. Those are your masters. That tells all the history of the manufacturer that we as a company did for that drug product. To uniformly assure from batch to batch master production control records for each drug product, including each batch size, shall be prepared, dated, and signed. Well, we don't have batches where we are making different groups of products. We only have oxygen or nitrogen. That's why our production logs are also our master production and batch production and control records. Production record review 211.192. Your QCU member will review the production for that day. He'll review each and every log for completeness, for accuracy, for obliterations. If there are errors, it will be the QCU person's responsibility to have the processor fix the errors. He will sign off on the production after he is assured that everything is where it should be, what it should be. He will release the product. The product then can be moved to the released for distribution pile. Laboratory records. Laboratory records include the calibration of the gauges, the thermometers. They all need to be reviewed by the QCU person. They also deal with the testing of drug products, the filters for the Servomex, a weekly filter check. They need to be done. They need to be signed off. Distribution records. Distribution records are our delivery logs, delivery tickets. These tickets show the proper name, address, phone number of the person that we are delivering the drug product to. The people that deliver the drug product will complete the delivery ticket by designating how many were given to the or sold to the customer, how many were returned from the customer, and the appropriate lot codes for that delivery. That's part of your distribution records. We get into complaint files. Complaints are one of the hardest things that I know of that any company has to deal with. Nobody wants to admit that they've put out an inferior product or our customer deems it to be inferior. So when we're dealing with complaints, we have a specific process, a specific procedure to document the complaint. The initial people that are going to be documenting complaints will probably be the driver personnel and the customer service personnel. When a customer calls into customer service and says, I got 2 cylinders and they both appear to be only half full, it's at that time that we need to generate a complaint, and it needs to go to the appropriate branch so that the appropriate branch can start its investigation. Complaints can be a number of things. They can be something as simple as I can't get the valve to turn on, or something as bad as this gas smells. There's something wrong. It's got an odor. Oxygen and nitrogen don't have odors. So if you have a complaint about an odor, you need to do an immediate investigation. One of the reasons why complaint files are so difficult is the people that are returning the cylinder don't designate which cylinder it is. So you might have a customer return 200 cylinders, and they complained that they had one that had 1,000 psi. Which one was it? We need to know that, and we need to instruct our customers that if they have a complaint, or one of their customers has a complaint, that cylinder needs to be marked in such a manner so that when it comes back through our filling process, we can address it. Maybe the valve has what we call a spinner, where it'll never turn on because the stem is broken. Or maybe it's got a bad safety. Or maybe the bonnet nut is not tight, so it's leaking out the top. Or maybe it's got a gouge along the outlet where it won't seal to their regulator. In all these cases, we don't want that same cylinder to go back to a different customer and initiate a different complaint. We want to remedy the situation. So when we have our customer service folk speaking with the customer, or our driver personnel speaking with the customer, they need to try to explain exactly what it is that is the matter and which particular cylinder is affected, or which group of cylinders is affected. We have had it happen in the past where cylinders were delivered, 12 out of the 72 were empty. Now, why did that happen? Well, because the previous rack, they only had 60 cylinders to fill, so they shut off the last 12. And on the next rack, they forgot to open that particular section that they shut off. That's a major complaint. So we have a specific form for complaints. We need to take a look at that form, become familiar with the form. The complaint files are just like our production records, our receipt logs for bulk product. They must be retained for 3 years plus the current year. Additionally, the complaint files need to be audited on an annual basis by the QCU department to see if there are any trends or systemic issues that are developed because of the complaints. By trends, are we getting more complaints from one customer than anybody else? That's a trend. We need to talk to that customer. Or a trend, are we getting more cylinders that people are complaining are not filled to the capacity that they're supposed to be, i.e. a K that is filled to 2,000 psi when it should be 2,200 at 70 degrees? Are we getting a lot of that type of complaint? Are we getting a lot of appearance complaint? That's another customer complaint. And because it is a medical drug product, it needs to be documented. The appearance. Well, what about the appearance? Well, the label was scratched. I couldn't read the precautionary statements. Oh my, that's terrible, because that's part of our labeling process. It may have gotten damaged during shipment. It may have gotten damaged from the shipment from the DME to the end user. We don't know. We just know we have a complaint. We have to investigate it. Once the complaints are done, then a QCU person will sign off, and the complaint needs to go to corporate. Corporate maintains a full complaint file for each and every branch that does medical drug gases. When a complaint is completed and it's closed, we need to contact the customer with our findings. Let them know what we found out. Yes, Mr. Smith, the cylinder was partially full or mostly empty, whichever way you want to talk about it. And this is what we found. When the cylinder was shut off, it didn't leak. When it was turned on, it did leak through the bonnet nut. So we replaced the valve, and we will be issuing you a credit for one cylinder. The customer is happy. The complaint has been completed. Next on the agenda is returned and salvaged drug products. Returned drug products. Very short, very sweet. There are no returned drug products. Once the product leaves our control, if a customer says, I overordered and I only wanted 10 E's, but I ordered 15, can I return these 5 for credit? No, you can't. It is a drug. It would be the same thing as going to your local pharmacy and saying, well, I got 30 days worth of pills, but I felt better after 20, so can I return these 10? No, they're not going to do that. They'll dispose of them for you, but they won't return them. When we pick up cylinders that are being returned to us for refill, even if they're full, they are empty. We treat every return cylinder that our drivers pick up as empty. Goes hand in hand with drug product salvaging. Again, pharmacies can salvage some drug products, some that cannot. We do not salvage drug product. Now, that being said, I want to reiterate what we talked about with it was liquid nitrogen and liquid oxygen. I wouldn't call it salvaging, but we are putting brand new drug product on top of old drug product, giving us commingled drug product. And again, we can do this because each and every liquid container is tested for identity, strength, and odor. Each and every liquid container is given a COA, Certificate of Analysis, that shows in writing what the assay was, what the odor was, what the identity was, and it's signed by the filler and dated. The next section, Part 310, deals with new drugs, and I won't get into a lot about it. Matter of fact, I'll say very little about it. 310 deals with the pharmacies and the research laboratories, research universities. It gives them the guidelines of how to go about certifying their new drugs, their investigational drugs, and things of that nature. So it does not pertain to the compressed gas business today. That's not to say that maybe some very smart research scientist comes up with a better way of doing oxygen, for example. They may classify that as a new drug. I'm just using that as an example to say we're not totally exempt from it. It just doesn't apply today. Next, we're going to take a look at some of the topics to be reviewed. This would include the overview of the Food and Drug and Cosmetic Act, which we've just spent quite a bit of time going through. Also, it's going to tell us what makes a medical gas a drug or a device, or neither. What constitutes misbranded and adulterated drugs? What are some of the prohibited acts? And the regulatory actions and penalties. So what is it? Is it a drug? Is it a medical device? Or is it something else? Well, let's take a look and find out. If it is a drug, it will be recognized in the USPNF. Now, USP stands for United States Pharmacopoeia. They are an organization that sets up the guidelines and the requirements for specific gases, as well as for your drugs. NF is National Formulary, another organization. National Formulary has set up the specifications and the monogram for nitrogen NF. But as you can see from this slide, oxygen USP is a drug, nitrogen NF is a drug, helium USP, carbon dioxide USP, nitrous oxide USP, and medical air. They are all classified as drugs. How did they get classified as drugs? Well, they are intended to diagnose, treat, or prevent a disease in man or animal. It's intended to affect the body, and it may be used as a component in other mixes, or other gases, I should say, to make a compound, two-component, three-component gas. For example, CO2 and oxygen, helium and oxygen. Cylinders and cryogenic vessels themselves are considered drugs when they contain a drug product. So again, this is how they fall under the Food and Drug and Cosmetic Act. The container itself is considered a drug if it contains a drug gas. Well, then what makes a medical device? Well, we can figure some of it out pretty rapidly. It's an instrument or an apparatus or a machine or an implant. Take, for example, the PB41s, the liquid oxygen reservoirs. They're a device. They're a machine. Regulators, medical regulators, are devices. They are an instrument. So it's recognized in USP-NF, United States Formulary, or United States Pharmacopoeia, National Formulary. It is intended to diagnose, treat, or prevent disease in man or other animals. It is intended to affect the body, but it does not achieve its primary purpose through chemical action within or on the body. So we look back, we talk about drugs, oxygen. Oxygen is used for people that have hypoxia. It's used for people that have pneumonia. It actually increases the amount of oxygen in the blood system. Whereas some of the other gases, like your lung diffusion gases, they are intended to diagnose or probably treat a man or other animal, but it does not achieve its primary purpose within or on the body, a chemical reaction. Examples of your device gases: carbon dioxide, oxygen, and helium oxygen can be classified as either a drug or as a device. If it's a drug, like the helium oxygen mixture, it's used for therapeutic and recuperative purposes. If it's used for anything else, then it becomes a device. Pulmonary function gases, which would be your lung diffusion gases. Your blood gas mixtures, which would typically be your 5% CO2s, balanced nitrogens. Anaerobic and aerobic gas mixtures, 10 CO2, 5 hydrogen, balanced nitrogen, or 10 CO2, 10 hydrogen, balanced nitrogen. Nitrogen NF used for cryogenic properties. Think about your folks that remove warts. It becomes a device because it's removing that wart. And of course your laser gas mixes. Laser gases are more or less going out of fashion now. They have different gases, different types of lasers that don't take the gases. A gas that is not a drug or a medical device. Well, ABO, aviator breathing oxygen. It is presently not considered a drug. It is presently not considered a device. There are issues with this because aviator breathing oxygen, the only difference between that and our normal USP oxygen is the moisture level of the aviator breathing oxygen. The moisture level is extremely low so that when pilots are using it, it does not freeze on their system. Self-contained breathing apparatus or self-contained underwater breathing apparatus or other diving mixtures like helium, nitrogen, oxygen. Presently, food-grade products, gases. This will be changing in the very near future. But presently, food grade is not a drug. It is not a device. The calibration gases that we use to calibrate our servomexes, any of the analytical equipments that we may use, or that anybody else's use. Think specifically of oxygen zero, helium ultra high purity. There are a number of gases that are used for calibration of analytical instruments. They're not a device. They're not a drug. We talked at length about labeling, and we talked at length about what constitutes a label. This is just a review. A label is a display of written, printed, or graphic matter upon the immediate container of any drug. Our product label, oxygen USP, nitrogen NF, our drug product label is considered a label. Labeling is our lot codes. It is not a drug product label, but it's all the other labels or other written, printed, or graphic matter upon any drug or its containers or wrappers or accompanying any drug. Remember I said earlier that there may be an occasion where there's an exemption about the label has to be on the container itself, citing the pharmaceutical industry that may have small vials. And it is appropriate for them to be able to put the printed material in the wrapper or box that the vial goes in. But our lot codes would be considered labeling. On our newer cylinders that have our Hellgate Gas Products logo and information, that piece is considered labeling. We talked a little bit about misbranded drugs. We talked a little bit about adulterated drugs. These are two different classifications that the Food and Drug Administration, when they do an investigation, may cite us on if we are not following our own procedures. What constitutes a misbranded drug? If the labeling is false or misleading. I cited earlier about a K of oxygen that was filled to 2000 psi at 70 degrees, but it was labeled with the appropriate label contents for a cylinder that had been filled to 2200 psi at 70 degrees. The labeling, the lot code, is wrong. It's false, it is misleading. It's understating or overstating the contents. If the labeling is missing the required information, okay, the required information, because of the Global Harmonization Act, has changed. Not only is the information requiring the name, it is requiring the complete address. It used to only require the city and state and zip. If the net quantity of the contents is missing, instead of having 680 liters stated on the lot code tag, there's nothing stated on the lot code tag. Something happened and it didn't get stated. Maybe it got ripped off, or maybe the processor didn't finish his labeling operation. If a drug product is manufactured in an unregistered facility, all of that drug product is considered misbranded. There have been instances where facilities have decided to get into the medical field, selling medical gases, but decided that they would not want to be under the purveyance of the FDA. So they just never bothered to register until one day they were found out, and then we will get into that a little bit later, but there was some very stiff penalties. If labeling is not readable, our procedure for filling cylinders is to have an inspection of the label prior to it going onto the rack to be filled. If there are any tears, discoloration, or anything else where you cannot read each and every word on that label must come off. If the label for, say, nitrogen NF, the green diamond, is not green but more turquoise, that has to come off because it falls under the DOT requirements. But because we're talking about labeling, we can talk both sides of the federal government. So any label that is on a drug product must be 100% readable. What makes an adulterated drug? Well, we've talked about what makes a misbranded drug. Now, the adulterated drug, if it consists of any filthy, putrid, or decomposed substance. Again, that goes kind of with the pharmaceutical. However, if it consists of any filthy, putrid being the key word for the medical gas facilities. Putrid, it has an odor. That could be an adulterated drug. It would most definitely be a complaint. If it has been prepared, packed, or held whereby it may have been contaminated or have been rendered injurious to health. The big word is may. The Food and Drug investigator, when he's investigating your facility, will be looking at your facility, not just your standards and your procedures and your personnel. He will be looking at your facility. And if he deems that your facility is filthy, he could deem that your drug product that you have manufactured is adulterated. If the filling racks are all dirty, they've never been cleaned, they have remnants of scraped labels on them, the floor is filthy, the bathrooms are filthy, if there's no cleanliness at all, he could render your entire drug product line adulterated. And we will get into some of the ramifications of having that happen. If the methods used in its manufacture do not conform to current good manufacturing practices, the drug is adulterated. We go through a number of procedures in the pre-fill, fill, and post-fill of our drug products. Each one of these steps is a required step for the manufacture of that drug product. If we skip a step, then we are not complying to current good manufacturing practices, nor are we following our own SOPs, standard operating procedures. Therefore, that drug is adulterated. If its container is composed of any poisonous or deleterious substance which may render the contents injurious to health. Won't have that happen too much in the gas industry, in the medical gas industry. More along the lines of pharmaceuticals, where they are getting in containers of big tubs of plastic caps, plastic jars, bottles, that maybe something happened to them, a roof leaked, they got dirty. So that's where that would come from. If its strength and purity fall below USP standards, they use purity here, we use assay. I explained that earlier. Strength, purity, assay, fall below USP standards. USP standards for oxygen, nitrogen, and nitrous oxide are 99.0%. Hellgate gas products standards are 99.5%. We want it that high because we don't want to get close to the lower limits. We know our product coming in from our manufacturers is greater than 99.5. So we feel very confident that we can keep our standards at 99.5. Now, what does that mean? If we have an out-of-spec procedure or out-of-spec situation where take oxygen for example, oxygen comes in at 99.45, then we're okay as far as the Food and Drug is concerned because their standard is 99.0. But we are not okay per our own standards. And our own standards say that it is out of spec if it is less than 99.5. At which time we have a out of spec procedure that we must follow and investigation. What are some of the prohibited acts? There are things that you can do, things that you must do, and things that you should never do. Prohibited. Failure to register. If you remember earlier on, I gave the example of a welding supply company that decided to get into the medical gases, and they just didn't bother to register with the Food and Drug Administration and get their label code. So that became a misbranded product. Refusing to permit inspections. That is a prohibited act. You can ask if something is, pressing you that day and you just don't have the time. You can ask. And it would probably be like talking into the wind. They're probably going to say, no, we're here to do it today. Okay, that's good. You cannot refuse to permit an inspection. Because we deal in interstate commerce, that's where the Food and Drug Administration gets their authority to investigate us for compliance to current good manufacturing practices. Refusing to permit access to and copying records. There are certain records that they can copy and that they will copy, and there are certain records that they do not copy. They can copy records that pertain to the production of the drug product gas. They can copy your bulk receiving log, your label log, your Servomex calibration log, thermometer calibration log, training records. They can copy any of that without an issue. Sales? No, they cannot copy your sales records. Your distribution records, however, are a different story. They can copy those. Altering or labeling a part or whole which causes misbranding or adulteration. All right, some people, some companies have an expiration date on their device gases. They also have an expiration date on their drug gases. If you had a device gas, say, and the expiration date was beyond today's date, and you decided, why don't I just cut that off and claim that it was got wore off? That's misbranding. That's also adulteration. Altering a label which causes misbranding. If you alter a medical label, if you alter the lot code, those are all misbranding. Delivering or receiving for delivery adulterated or misbranded products. If we are delivering misbranded or adulterated products, we have failed ourselves, our employees, and our customers. There should never ever be an instance where we would deliver an adulterated or misbranded product. Remember, misbranded. If you lot code an M6 that is supposed to have 164 liters in it at 70 degrees with D liters, 425 at 70 degrees, because you failed to change your lot code gun, that's misbranding. It should have never gotten into the released for distribution because the QCU member that was doing the review and release should have caught it. Adulterated would be we're not following our own SOPs. We've skipped steps, we've taken shortcuts. Again, it becomes the job of the QCU member and the individual doing the processing, the manufacturer of the drug gas, to ensure that they are following the procedures step by step in the order that they are supposed to be. As far as receiving for delivery adulterated or misbranded products, when we receive our specialty gas from our specialty gas manufacturer, if there is no lot code on the device gases, that's a misbranded product. If we can't read the label because it has become obliterated or torn, that's a misbranded product. We should not be receiving those from our vendor. We should refuse that shipment. Regulatory action and penalties. When a FDA inspector comes in, the first document that he's going to present the manager in charge would be the Form 482. That is the authorization to inspect the premises and gather any records that they want to gather. You will go through the whole investigation, and the investigator will walk the plant, get a feel for the physical layout. He'll watch your processors fill. He may ask your processors questions. He'll come back to the office. He will review all of your production records that he wants. He'll review your label logs, complaint files, training files, calibration files, maintenance files, and then at the conclusion, he may or may not issue a 483, which is a report of observations. If he does issue a 483, it would list the items that the investigator finds objectionable. Now, a 483 is a 483, but for sake of argument, there are three different classes of 483s. The first class is what I call a Class 1. Now, that's a 483 that was issued to the branch or the company, and it was something of objection that the investigator found, but the manager in charge that was handling the investigation could not explain it away, could not explain the use of a Dreger tube, or could not explain, even though procedurally we were doing it correctly, because the investigator couldn't see it happen at that time, he depended upon the manager in charge to explain it. He couldn't explain it, therefore he didn't know what was going on. So that would be like a Class 1. A Class 2 would be the investigator took issue with something that was in the manual. He took issue saying that it was objectionable, and our stance was no, it met the requirements. So that would be what I would class 2. Now, Class 3 is, in my mind, the worst one. A Class 3 is we're not following our own procedures. which immediately makes the products that we are manufacturing adulterated. That's absolutely the worst thing that could happen. A 483 does not require a response, but anytime we get a 483, we will respond with the timeline of the corrective action and what the corrective action is going to be. If the penalty or the 483 is serious enough, a warning letter will be issued, and it will be issued to the owner of the company. It'll be issued by the district office based on the investigator's findings. It will have the center's approval, which means, as you can see, it goes through the center, it goes through the compliance, and the Office of General Counsel for the FDA. It will cite the specific sections of the law that we are in violation of. It will anticipate that we will voluntarily correct the issues. It definitely requires a 15-day response. And according to the research I've done, the numbers are down for the medical gas industry, but the significance, the objections are significantly more severe. Now, if the FDA does not accept your response to the warning letter, they may or may not require a meeting. There's not a requirement. It's just based on the history. If your firm has a history of non-compliance, you can expect to be invited to a meeting. The FDA will invite the company to meet at the district office, and the company officials are expected to attend. They want to make sure that the company is impressed with the seriousness of the situation. It's not a threat. However, they're letting you know you're skating on some really thin ice, and the corrective action needs to be appropriate, it needs to be documented, and it needs to be completed. It's hoping for a voluntary correction to any of the problems or observations that they took issue with. It's anticipated that we give commitments for the correction, not only the correction, but the ongoing assurance that something of that nature won't happen again. The corrective measures that we take today have to resolve the issue today and ensure that going forward, that issue doesn't come up again. Regulatory actions and penalties. Seizure. The FDA will go to court. They will seek a court order, and they will probably get that court order, and it's filed against the product. So you have the United States of America versus Oxygen USP. The federal marshal will come in, and with a roll of yellow tape, he will yellow tape your facility. There may be a consent decree. It could be negotiated. There is a bond, which you would probably, depending upon the volume of drug product that your firm produced, it could be a significant number. It could be a 6 or a 7-digit number. And the products must be destroyed or reconditioned. Well, there's no reconditioning to oxygen, gas, nitrogen, nitrous oxide. Typically, it would be vented to the atmosphere. The bulk product would be vented to the atmosphere, and you would basically have to start all over from scratch. The FDA can get the injunction. They'll go to court against the company and or the persons, usually the top official. If it goes to an injunction, then what that purpose is to put the person and or the company out of business, out of the medical gas business. They have done such a poor job of compliance. They've had no regard to making the corrective actions. It's kind of like somebody saying, well, who are you to tell me what to do? These guys have the clout. They will tell you what to do. You better pay attention. Again, consent decree may be negotiated, but if that's negotiated, it will be a detailed compliance plan, step by step by step. And you can almost be assured that the FDA will not accept your first iteration. You will probably be asked to readdress many issues. You will probably have to have an outside consultant to certify that you are doing exactly what you said you were going to do in your compliance plan. Certified consultants are not cheap. They are extremely expensive. If you had to get one from out west or out east or down south, you would be paying for transportation, food and lodging, plus a daily rate. Typically, that consultant is going to be at your facility for 2 to 3 days. Going forward from that point, the company will pay for all FDA inspections until the injunction is lifted. The FDA is not too quick on lifting injunctions. The operation could even get to a point where it is under FDA supervision, which would mean, like the food manufacturing facilities, packing plants, things of that nature, they have an FDA inspector on site at all times that processes are being worked out. Non-compliance to current good manufacturing practices, to our own SOPs, is extremely expensive. You can get into the 6-7 digit figures. But that's just the monetary end of it. Take a look at what the criminal charges could be. If you're found guilty of your first offense, it could be the company, it could be the company officer, or it could be an employee that could be imprisoned up to 1 year and or fined $100,000. Now, if death occurred, it'd be $250,000. If that didn't get your attention and you were found guilty of a subsequent offense, you could be imprisoned up to 3 years and or fined $250,000 to $500,000 for each violation. Now, if we have a facility that is filling 72 cylinders at a time, it could be interpreted that each violation could be either 72 violations for each rack, or 1 violation per lot. In either case, if it was 1 violation per lot and your branch did 8 racks in a day, that's $4 million, potentially. Parts 210 and 211, we spent a lot of time going through. We are just going to review now some of the things that 210 and 211 contain. Remember, these are the minimum current good manufacturing practices. These are not all encompassing. The purpose of the current good manufacturing practice is to assure that a drug meets the requirements of the Act as to the safety and has the identity and strength, meets the quality and purity characteristics that it purports or is represented to possess. That's the purpose of current good manufacturing practices. Think of it this way. You want to make sure that your grandmother that is receiving oxygen from us, from Hellgate Gas Products, is receiving the best that she can receive. No shortcuts. That's how you think about it. It puts it on a personal perspective. If you fail to comply to the current good manufacturing practices, it renders that drug to be adulterated. The drug, as well as the person who is responsible for the failure to comply with current good manufacturing practices, shall be subject to the regulatory action. And we saw just previous how expensive that could be or how time consuming that could be. First offense, possible 1 year imprisonment. Subsequent offenses, possible 3 years per occurrence. The subparts of 21 CFR 211, which are the good manufacturing practices, gives you the general provisions, the organization and the personnel, the buildings and the facilities, the equipment, the control of the components, containers, and closures. It also deals with production and process controls, packaging and label controls, holding and distribution, laboratory controls, records and reports, returned and salvaged drug products. It's just kind of an overview of what 211 is. How do these rules, these CGMPs, apply? They apply to all Hellgate Gas Products manufacturing operations based on how we receive our medical gas supplies, what intermediary supply vessels we fill, what level of control we retain over our supply and final drug product container, and what final drug product containers we fill. .210 and 211 of the CFR 21 contain the minimum current good manufacturing practices for preparation of drug products for administration to humans or animals. In 211.3, the definitions found in 210.3 apply to this section as well. We already discussed what a batch is versus what a lot is. A batch is a specific quantity of a drug that has uniform character and quality within specified limits and is produced according to a single manufacturing order during the same cycle of manufacture. Your bulk tanks contain batches. A lot, on the other hand, is a specific identified portion of a batch produced by continuous process, produced in a unit of time or quantity having uniform character and quality within specified limits. Batch number and lot numbers. are any distinctive combination of letters, numbers, or symbols from which the complete history of the manufacturer, processing, packaging, holding, and distribution of the batch or lot of drug product can be determined. We discussed earlier about the formulation, how we formulate it. This gives us the ability to go back clear through our records, knowing what day we filled the vessel or cylinders, what the bulk batch number is, because we can go back to our bulk receiving log and figure that out. Another definition, component is any ingredient intended for use in the manufacture of a drug product. Oxygen is a component. Drug product is a finished dosage form that contains an active drug ingredient. Drug product, oxygen, USP in cylinder form, that has been released and has been distributed. In-process material is any material fabricated, compounded, blended, or derived by chemical reaction that is produced for and used in the preparation of the drug product. Strength is the concentration or potency of the drug substance. Manufacturing, processing, packing, or holding of a drug product includes the packaging and labeling operations, the testing operation, quality control operation. You have a quality control unit, we call them quality control unit members, is any person or organizational element designated to be responsible for the duties relating to quality control. The QCU member is the person that can accept or reject bulk products, containers, processed products. So it is very important that the QCU member know his responsibilities to ensure that the drug product we produce is of the highest standard. What validation is it's establishing documented evidence providing a high degree of assurance a specific process will consistently produce a product meeting its predetermined specifications and quality attributes. Equipment suitability, verify that the resolution and reproducibility of the equipment is adequate for the function the equipment is performing. We want to make sure that the Servomex can reproduce the same results. If we tested the same cylinder 4 times, we should get the same result. Organization and personnel. In section 211, remember 211 was the extremely long section, but this gives you a little bit more information. The responsibilities of a QCU member. Standard operating procedures and quality system. Specifications. Manufacturing, distribution, operations, including record review, which is your secondary signature. Your review and your release. Testing, the approval or rejection of products. Guidance issues with QCU makeup reporting and activity are under review. The personnel qualifications found in 211.25 is an education and experience or a combination, training, job function, which we do an awful lot of hands-on training rather than book training. We do, after the hands-on training, we do have people study the standard operating procedures and the CGMP, which you are doing today. The training frequency. It's required that it should be ongoing and it should be adequate for the job function. Documentation of education, training, and experience. When a person comes with us, they have a application that they fill out. Then we have our training logs. And each time a person is trained on a different function, the training log should be filled out. There are specific requirements for supervisors. And of course, your staffing levels have to be adequate to the production of your drug product. You do not want to have a facility that has, say, 2 people trying to put out 20 racks of oxygen. You know something is going to go awry. Some shortcuts are going to be taken. There are a lot more requirements in 205.7 that we're not going to address at this time. We talked about the personal responsibilities. We talked about clothing being clean. We don't want people that have grease or greasy gloves working on the oxygen rack. We talked about sanitation habits and health conditions. We want to make sure that our facilities are clean. We want to make sure that our people take responsibility for making sure that things are clean. Under the guidance for color blindness, one of the things that we want to make sure of is that the person that is doing the processing can differentiate between colors. You do not want a person on the oxygen rack that is colorblind green, because oxygen is green. To him, that might mean brown. Well, medical helium is brown. So inadvertently, he could be hooking up or attempting to hook up a helium cylinder to an oxygen rack. Colds, one of our pre-fill steps is the odor test. One of our post-fill steps is the odor test. If a person is all plugged up, sinus congestion, how can they smell? How can they smell whether there is an odor? So there we need to address that so that if the processor has a sinus condition where he can't smell, somebody else do the odor test. Limited access areas, as I addressed earlier, we don't really have any limited access areas. The limited access areas that we do have are the labels themselves. That is limited. The QCU member should be dispensing the labels to the processor. 21134 deals with consultants. Very expensive if we ever have to go that way. Buildings, facilities, design and construction, and this applies to both buildings and vehicles. Remember, a vehicle that is distributing drug product is an extension of the warehouse that manufactured that drug product. So our delivery vehicles are an extension of our warehouses. As such, they fall under the same rules and guidelines that the warehouses do, i.e. segregation of full from empty, segregation industrial medical, proper lot coding, proper deliveries, proper documentation of fill logs if they're filling doers, of delivery tickets, documenting the correct lot code. Needs to be a suitable size and location to facilitate maintenance and proper operations. Adequate space to prevent mix-ups and contaminations. We don't have too much of a problem with contaminations. However, we can have a serious problem with mix-ups. If your full medical oxygen is right next to your full industrial oxygen, separate them. You would not want a driver to grab an industrial cylinder and deliver it to a medical account. And conversely, it's true. You don't want a driver picking a medical cylinder and delivering it to an industrial account because it is a drug gas. And as a drug gas, it can only be distributed by prescription, except to DMEs and people of that nature. Lighting, you want to have adequate lighting in all your areas. If you've got bulbs that are out or fluorescent fixtures that don't work, get them replaced so that your processors can see exactly what it is they're doing and they're not having to use flashlights. Ventilation, HVAC, heating, ventilation, air conditioning. Plumbing is important. We want to make sure that all of our plumbing is operating. If you've got a water heater that's defective, not giving you hot water, get it replaced because it's a requirement that you provide hot and cold water to the employees. Sewage and refuse, if you've got a backed up sink or backed up toilet, get it repaired. Refuse is garbage. If you've got garbage on the floor, make sure that it's picked up. Make sure that somebody is dumping it at least on a daily basis. We go through an awful lot of labels. We go through an awful lot of plastic. Cylinders come into us with, new cylinders come into us with plastic wrap on them. We pull that plastic wrap off. Washing and toilet facilities, I mentioned that with plumbing. We have to have hot and cold water. The toilet facilities have to be used. And sanitation, again, if we have dirty facilities, we could end up in the eyes of the FDA with an adulterated product. Keep all of your equipment in good working order, and if you do any maintenance, document what you've done when you did it. That way you will have documents. There are different facility requirements, security requirements, storage requirements. We won't go through these at this point. Equipment. Design, size, and location. For high pressure filling, you're going to need a storage tank, you're going to need a vaporizer, you're going to be needing pumps. You'll need a product, oxygen, and medically clean manifolds, permanent. No add-ons. Add-on racks are not allowed. There could be cross-contamination. There could be filling the product with the wrong, or the cylinders with the wrong product. Adapters. Dedicated connections first. All of our manifolds are dedicated. Oxygen, small, CGA 870. Large, CGA 540. Nitrogen, we have an exception here. Nitrogen is CGA 580. Beer blend is also CGA 580, as is argon, as is helium. So if you are filling any of those gases, you have to be extremely observant to make sure you're putting the proper gas in the proper vessel. Adapters, when is it okay and when is it not okay? It's not okay to circumvent the CGA designated valve configuration. But there are exceptions to that. When you are doing mixes you can use adapters. You have to use an adapter to go from CO2 to nitrogen to pre-fill your beer blend. That's okay. You cannot use an oxygen regulator on a nitrogen cylinder by using an adapter. That's not okay. Validation issues, we've got check valves, we've got vacuums, we've got pressure. Again, we make sure that our vacuum and pressure gauges are calibrated on an annual basis. Check valves are a stopgap measure. Check valves have been known to fail. So we want to make sure that if you have a leaking check valve, get it replaced because it's not doing what it's supposed to do. For liquid filling, we again have our oxygen, and this is what we're looking at basically, oxygen and medically clean dedicated connections. The hoses need to be protected from the environment. You should have caps to go on the end of your oxygen and nitrogen liquid filling hoses so that they do not get any dirt, insects, anything of that nature in there. Adapters are okay for home vehicles, CHVs, cryogenic home vehicles, because you have to be able to fill into their liquid tank. The vehicles need to have vent and road safeties, and there are a lot of other issues. There's only a few companies left that even have liquid delivery, and most of those now are going to the side. It's just too many hassles. The equipment construction surfaces that contact the product shall not be reactive, addictive, or absorptive. We don't want on the oxygen rack any product that may be of a petroleum-based product. Oxygen and a petroleum-based product are two ingredients out of the fire triangle. Lubricants or coolants shall not come in contact with products, again for the same reason. You have an oxidizer, you have a fuel. Now all you need is some sort of an ignition, as little as static electricity, and you could have a serious issue. Cleaning and maintenance, we do have procedures. We need to make sure that someone is responsible, that it's scheduled, and what equipment is going to be cleaned, what are we going to use to clean the equipment with. If we are rebuilding or repairing medical units like the PB41, PB46, things of that nature, how do we protect that clean equipment before we send it out? The inspection of our equipment immediately before use, again dealing with the equipment that we use to protect our drug gas. Check your manifold. Make sure that all the pins are in place on all of the yokes. Make sure that your gauges are in calibration. Make sure that your vacuum gauge is at 0. Automatic, mechanical, and electronic equipment. We have mechanical and electronic. We have mechanical gauges. We have vacuum gauges. We have scales, thermometers, and flow meters. We do our annual pressure and vacuum gauge calibration. Annually, we do scales. In the state of Missouri anyway, it's annually for the state, and then we have them verified every 6 months. Thermometers, we do those daily or any day that we're going to be using thermometers in our processing. Flow meters, we want to make sure that they are accurate so that when we are using them for the testing of the oxygen, we are not overflowing the servomex with too much pressure. There needs to be a written procedure for the calibration and operating manuals to include, and what standards we use, what frequency we use, and the performance qualification. When we are dealing with the annual gauge calibration, we have a standard calibration kit that we use. We do it annually. And we have parameters set up. We have a log that we can log the gauge, and we have parameters that we use to determine whether or not that gauge is within spec. We want to make sure, again, this is a review, we want to make sure that our equipment is clean, and when we do clean, we document that we cleaned it. Remember, I mentioned earlier that the FDA and the state boards of pharmacy, if it's not documented, it never happened. You can argue all you want, but you're going to lose. It never happened. So take a couple of minutes, document what you've done. If you've done any maintenance, document that you've done that maintenance. If you are doing any refurbishing of any equipment, i.e. the PB units, make sure that you have some clean tags so that you can document it that that has been cleaned, and you can bag it and tag it. Laboratory and testing equipment. Testing and release for distribution. Test methods and procedures must be scientifically sound and appropriate. They must be valid in terms of accuracy, sensitivity, specificity, and reproducibility. Must be suitable under actual conditions of use. These are the requirements for testing and release for distribution. Instrument calibration to include the procedure using the manufacturer's manuals, and then using our own manual to reflect the actual use. For example, in the Servomex Servomex manual, it says that we only need to zero the Servomex once a week. We do not do that. We zero the Servomex every day, or every day that it's going to be used. We specify what standards to use based upon the manufacturer's manual. We have written description of frequency, again talking about the Servomex. If the Servomex is bumped, it needs to be recalibrated. If the temperature rises or falls by 15 degrees or greater from the last time it was calibrated, it needs to be recalibrated. If you have an out-of-spec situation, your Servomex needs to be recalibrated. You can see here the laboratory records, the record of established methods and any deviations, the equipment parameters from the accepted method. Now I've written down here new USP/NF issues. When we put this first together some years back, the FDA was being pressured by United States Pharmacopoeia that we would have to have specified standards, and only USP and NF would be able to fill those standards and send them. Now that created a great big hubbub because USP could not possibly have filled all the standards that would have been required for all the medical gas branch facilities. Logistically, they wouldn't have enough cylinders. Logistically, they couldn't get it out fast enough. So that has been dropped. Laboratory standards, calibration standards, certificate of analysis. Each vessel that we fill, liquid vessel that we fill, will have a certificate of analysis. On our test calibration standard cylinders, where we are using to calibrate our Servomex, they must have a certificate of analysis. It must represent the USP standards. The calibration standard, or COA, must have a supplier's name and address. It must say name of product, oxygen, nitrogen. It can't say medical. It has to have a unique identification number. Now that's a serial number of the vessel, the tank, the actual analytical results, and the method of analysis. The actual analytical results need to be to 2 decimals if you have a 2 decimal Servomex that you are using to calibrate. The method of analysis cannot say, and this is on the vendor's COA, it cannot say by Servomex. It needs to specify what method, by Servomex model so-and-so. The supplier's signature and date. These are all significant things that must be on your standard cylinders for calibration of your Servomex. As you can see here, this is a certificate of analysis. It's not a very good picture. I tried, but it didn't come out well. You can see there is a serial number. You can see it's called nitrogen. You can see the analytical results. There's your serial number. Computer and electronic equipment. We're not going to spend a lot of time with this. The reason being is we aren't there yet. When we get there, we will have to develop a process and procedure to incorporate the validation, copy of the program, the management of changes, backup files, passcodes, things of this nature. We're just not there yet. Again, 21 CFR Part 11 deals with all the electronic records, signatures. We're not quite there yet. Working towards it. Components. I want to take a look at our components, which are our supply gases. Here's a scenario for you. We receive an initial supply into our stand tank, whether it's oxygen USP or nitrogen NF. We also do intermediary supplies, containers filled, like large cryogenic vessels. You're talking about your D55s. You might be talking about a portable unit of what we call a van fill. We need to have, and we do have, the written procedures for supply gases, which we have to follow. They're stored to prevent contamination. The supply lot and the batch numbering. And the supply lot identified as to its status, whether it is quarantined, whatever it is. That's part of the control of our components. We need to, of any untested, examine visually for appropriate labeling. Make sure that they've got their certificates of analysis. If you're dealing with medical devices, make sure that that says medical device. It needs to be quarantined until tested and released. So if a driver comes in and you're filling his van, he can't leave until it's been tested and released. Hold until tested and released by a quality control unit. It will be tested for the conformity with all the appropriate specifications, accepting the COA in lieu of a full testing. Our customers that we provide for the reservoir fills, the doer fills, they're the ones that get the COAs. They get it either on a delivery ticket or they get it as a tag that goes on the large D55 oxygens. Does not go with our stand tanks. We have a separate procedure for testing our stand tanks. When we receive a new bulk batch, we have to test the commingled batch to ensure that it meets our standards before any other product can be released. We've talked a little bit about the certificate of analysis. Again, supplier's name and address, name of the product. On oxygen, it needs to say air liquefaction. It could have happened years ago that you could have gotten a letter from your vendor stating that oxygen was produced by air liquefaction. Now the COA has to have that on there. A lot number or other unique identifier. A lot number is your trace, your part of history. The actual analytical results for identity and assay, and any other tests that may be appropriate for the gas. Nitrous oxide has, I think, 9 tests that the vendor does. Test method used, which is the analyzer. Again, it has to specify Servomex model so-and-so or chromatogram so-and-so. It just can't say by Servomex. Then it needs to be signed by the supplier and dated. And if they require it, a witness signature and date. We do not require that. Okay, use of approved components, FIFO, it's not critical, but it's economic. It may not be critical, but if you aren't in a FIFO mode, what you may end up with is cylinders that are a year or two old sitting on your floor because everybody is taking from the front of the pile and not from the back of the pile. So those cylinders that are in the back are just sitting there gathering dust. They need to be brought forward and the newer cylinders sent to the back of the pile so that you can get rid of those old lot codes. Retesting of approved components. We test everything. We test it when it is done, filled. We test it for assay, we test it for ID, and we test it for odor. After all the tests are done, the QCU will release the product. Any rejected components, they go right into quarantine. Testing supply. Laboratory controls for supply gas testing. The general requirements, sets up our specifications, the standards, the sampling plans, and the procedures. They must be scientifically sound and appropriate. They must be established in writing. They must be approved. Any deviation from these specifications, sampling plans, test methods, and procedures must be established and in writing and approved. Prior to release, appropriate laboratory determinations of conformance to final specifications. Adequate acceptance criteria. Products failing to meet specifications shall be rejected. Out of specification OOS procedure required. Let's take a look at our out of spec procedure. If a product, medical gas, is out of specification, by that I mean we test it and the assay is below our stated requirement of 99.5, we have a procedure that we must follow in order to determine if the entire lot has been affected or if maybe the analytical equipment that we're using has gone out of calibration. There's a requirement for 3 additional tests, and if the 3 additional tests after the analytical equipment has been recalibrated, if the 3 additional tests continue to show that product as being lower than our stated standards, an investigation into what happened needs to be performed. It could have been something as simple as the cylinders were not evacuated, which would mean we were not following our procedures in a step-by-step fashion, or they were not blown down and not evacuated, again, not following our procedures. So the investigation is intense, and it is designed to find the root cause and cure that root cause. The investigation should be timely, and a QCU member needs to be involved. It should be thorough. Was the test performed correctly? Again, was the analytical equipment properly calibrated? Was there a major temperature change? If you'll remember earlier, I made the statement that if the temperature rises or falls by 15 degrees or more since the last calibration, the Servomex must be recalibrated. There are other issues. Bad product. If we have bad product, it has affected the entire batch. We must develop and document the assignable or probable cause. And we have a retest plan. Once is not enough. We will retest it 3 additional times. The investigation conclusions, impact on other results. Document everything. Again, I can't stress strongly enough, if it is not documented, it never happened. That's the way the FDA looks at things. That's the way the state boards of pharmacies look at things. Our supply gas records. Component records. The component records show the identity, the quantity, the supplier lot number, and the date of receipt. It will show a copy of the Certificate of Analysis, the COA. And we will record the incoming inspections and tests. So when we receive our bulk product, whether it be bulk oxygen, nitrogen, nitrous oxide, before any product is released after the commingled product, it needs to be tested. Supply testing scenarios, the storage tanks and the large cryogenic vessels. Each storage tank has its own test ports so that you can test the commingled product of the bulk tank. Cryogenic vessels like vans are also tested because it is commingled product. The certificate of analysis for the delivered product is required, and we test the commingled product for appropriate USP National Formulary conformance prior to use. The sample line comes directly from the top of the tank, and that's our validation. We could test the cylinder from the first filling sequence. However, our procedures state that we will test from the bulk tank. Dedicated cryogenic vessels, which are previously empty and purged, are part filled with liquid directly from the tank. That's another way of testing directly from the tank. Large cryogenic supply vessels filled by Hellgate Gas Products, filled from a properly qualified supply, which is our bulk batch. Each cryogenic supply vessel tested for ID, odor, and assay, and CO, carbon monoxide, for nitrogen. However, that has changed now. We do not have to test for CO on each cryogenic vessel. We test for CO, carbon monoxide, on the receipt of the bulk product. The FDA's enforcement discretion for HRCs will not apply to Hellgate Gas Products, but may apply to its customers. There's no testing required, provided only liquid oxygen is filled on the premises. The vessel is dedicated to home care oxygen use. The vessel has not been empty or out of service. Vessel is considered empty if it contains no liquid and vessel pressure is below 15 psig. Cryogenic vessels filled by HGP as the supplier, and these are the customer's requirements. The customer should annually verify HGP is registered. The vessel needs to be properly labeled with the product label and with the lot number. Obtain a valid COA from Hellgate Gas Products. Each of our bulk cylinders, the D55s, the GP45s, whether they're nitrogen, oxygen, nitrous oxide, each one will come with a certificate of analysis. If the tests are witnessed by the customer, no additional testing is required prior to their use. The person witnessing must be trained on Hellgate Gas Products test methods and their training documented. When we fill cylinders, the D55s, the GP45s, many times the vendor or the customer is not there. So when they receive it, if the test is not witnessed by that customer, they must run an ID test on each vessel prior to its use, and they must annually verify Hellgate Gas Products test results. I'm going to take a look at containers and closures. The control of components, containers, and closures. We spoke just recently now about the components, which is a supply gas. Now we'll talk about the containers and closures. They're high pressure cylinders and their valves. They are cryogenic cylinders and their piping, valves, and fittings. They are vehicle mounted vessels and their piping, valves, transfer hoses, and fittings, as well as our storage tanks and their piping, valves, and fittings. If you remember earlier on, drug products. A drug is considered if it is recognized by USP or National Formulary as a drug Also, the container is recognized as a drug if it contains a drug product. The general requirements are the written procedures for the receipt, the identification, the storage, the handling, the sampling, testing, and approval or rejection of containers and closures. The accepted vendors. There could be a potential impact of guidance. Right now, we don't have any guidance documents. All of the vendors have been accepted. They have been audited, if you will. So they are in compliance because they are manufacturing according to the DOT standards. Handling and storage to prevent contamination. When we receive our cylinders, if they are valved, that will stop the dust from entering into the cylinder. If they are unvalved, the cylinders need to be capped. They need to have a plastic plug. If during the course of operation we have to remove a valve from a cylinder, and we may not have a valve to put back into that cylinder, maybe we're just out at that time, we need to make sure that the top of that cylinder is covered so that no dust, debris, insects get inside that cylinder and contaminate it. Lot numbers and codes for containers and closures. When appropriate, we do not have to do that with our oxygen cylinders, nitrogen cylinders, high pressure cylinders at all. Valves, we don't have to do that. In the pharmaceutical end, they do have to assign lot numbers or lot codes for the plastic containers that they receive, the caps that they receive, etc. Receipt and storage of untested containers and closures. Visual examination for labeling. Are they damaged? Do they have broken seals? Were they contaminated? Did they get wet? Were there caps in there? These are things that we have to look at, and they are going to be quarantined until they are released, until they have been thoroughly inspected to make sure that they are appropriate for drug products. Testing and approval or rejection of containers and closures. They would be withheld from use, quarantined, until released by a QCU unit member. The established supplier reliability. Customer or vendors like Sherwood are constantly being monitored for compliance to regulations from the DOT and the Food and Drug, because the valves that they use, the regulators that they use, are all devices. We examine for contamination. Again, we're looking to see, are the cylinders appropriate? Are they clean? We don't test our cylinders other than the hydrostatic test, which is required on all aluminum every 5 years. On steels, could be either 5 or 10, depending on if there is a star behind the most recent test date. Section 21186 deals with the use of approved containers and closures. 87 is the retesting of approved containers and closures. Retest or re-examination and approval by a QCU member when appropriate. This, again, goes more towards the pharmaceutical business than it does towards the compressed medical gas business. Rejected containers and closures, they are quarantined. The manufacturer will be contacted and some sort of disposition will be decided. The containers and closures need to be non-reactive, non-additive, non-absorptive to alter safety, identity, strength, quality, or purity of the drug product. We blow down and evacuate all high-pressure cylinders. What it does and what it does not do. What it does is it ensures that we have all of the previous drug product removed from the cylinder. When you open the valve of a cylinder and blow the pressure down, when it stops blowing, the question that is asked is that cylinder empty? Well, in fact, it is not empty. It actually still has 14.7 pounds of pressure in it, because that is what our atmospheric pressure is. That's 1 atmosphere, 14.7 pounds per square inch. So that cylinder still has 14.7 pounds of previous drug product. So after the cylinder is blown down and evacuated, we are ensuring that we have gotten all of the previous product out of the cylinder. What it does not do, it does not increase the purity or the assay of the drug product that is being introduced back into that cylinder. Add-on or daisy chain racks, they are an issue. They are an issue because they can be moved to different gas stations, and I don't mean like mobile oil. I'm talking about the station for oxygen or nitrogen or CO2. They can be moved and hooked up. You could have cross-contamination. This is why each of the racks is specific to that specific gas. An add-on or a daisy chain rack could be put just about anywhere. Purge liquid hoses and containers. When you're in the filling process, before you fill a liquid cylinder, whether it be nitrous or oxygen or nitrogen, whether it be a van or even a home care unit, you want to be sure and purge the hose first. This just ensures that all the dust and dirt and ambient air is blown out of the hose before you start introducing the new drug product. You want to inspect that hose for contamination. Did it get wet? Did it fall on the floor and fall into maybe a slushy snow or dirt or mud? You don't want to be using that without cleaning it off and introducing contaminants into your containers. The specifications, the sampling plans, the test methods and procedures must be in writing again, and they must be scientifically sound and appropriate and approved. They must be representative. We do not have to do a 100% inspection, but we do have to inspect all of our cylinders. 100% inspection goes basically back to the pharmaceutical industry. Container records. Drug product container closure records. Records show the identity, the quantity, the supplier, the identifier, the date of receipt when that's appropriate. Records of incoming inspections. Document vehicle-mounted vessels, cryogenic containers, the cylinder prefill inspection. Document your hose inspection and the purge. Document any maintenance that is performed. This could become a potential issue. There are new draft guidance out there that will more finely define what is required for the maintenance documentation. Vehicle-mounted vessels, inspect for the following. Inspect that it has the DOT markings. It should have a DOT tag attached to the vessel. Make sure that there is placarding. As a hazardous materials shipper, It is our responsibility to offer placards to the customer if they do not have placards. Perform your visual inspection. Make sure that the vessel is clean. Make sure that the CGA connection inspection is done, your outlet type, whether it operates smoothly, is it contaminated, does it have a relief device, have you looked at the hose. There is a label issue per the recent inspections versus a draft guidance, and that is being discussed. Nothing new has come out yet. Testing the residual before, and some suppliers require this, and I can see why it makes sense in some respects. Testing the residual, you want to test the vessel, the vehicle mounted vessel, when it gets to you before you fill it, rather than wasting your time filling a vessel and finding out after you've filled it that it was contaminated. We do not require that at this time. Our larger cryogenic vessels, make sure that they have the DOT markings on there, which will give you the specification being the DOT label. It's either a 4AL, 200, 230. You'll look for the serial number and the tare weight and the ownership markings. You look at the visual inspection, you're going to be looking at the vessel itself to see, is it damaged? Has it been dented to the point where the outside container has been punctured, or the outside container is pushed in so badly that it is almost touching the inside container? You'll find that out when you fill that vessel. There'll be almost an immediate frost spot. Label. They were talking about the label, potential new requirements. When I developed this series, that was before the Global Harmonization Act. There are new requirements now for the drug product label, and our company does comply with those requirements. You'll check the valve inlet and the outlet inspection to make sure that it is not contaminated, to make sure that it operates correctly. And there are going to be some new requirements for the closures, the valves themselves. Right now, we have to ensure that all drug product vessels have what we call a swap stop attached to the valves. The reason for this is so that there would not be any removal of outlets and putting in a different outlet, cross-contamination, if you will, putting a nitrogen outlet on an oxygen vessel. We want to make sure that the volume and contents gauge works, including the pressure gauge. If the pressure gauge is broken, replace it. High pressure cylinders. We want to check the DOT markings, the specification. What is it? Is it a 3AL 2015? Is it a 3A 2015? 3A 2065? What exactly is it? Pressure and plus sign, hydrostatic test date and the star, and the ownership markings. We want to check the visual inspection, the damage of the cylinder. Has there been any arc damages? Arcing would mean that somebody hit it with a welder of some sort. The condition, the steel and aluminum and the composites. There are composite cylinders out there that are fiberglass and aluminum. The color code. We have in the compressed medical gas business, we have assigned colors for assigned gases. Green is oxygen, brown is helium, gray is CO2, black is nitrogen, blue is nitrous oxide. When we set the cylinders up to be refilled, after they have been blown down and after we've done our visual inspection, on steel cylinders, we do what we call a dead ring. Lightly tap the side of the cylinder with a wrench and make sure that you have a nice clear ring, not a dull thud. A clear ring indicates that the cylinder's integrity has not been compromised. A thud could mean that there is a crack in the cylinder. It could mean that there is a contaminant inside the cylinder, like water. You don't do it on composite cylinders, and you do not do it on aluminum cylinders. Your valve inspection is the next inspection you're going to be doing. You're looking at the outlet. Is it the proper CGA outlet for the gas that the cylinder is designed to hold? If the cylinder is labeled for oxygen, it should have, for large cylinders, it should have a CGA 540 valve. If it is for the medical post cylinders, it should have the CGA 870 post valve. Want to make sure that the operation of the valve is smooth, that it does close and does open. You want to inspect it for contamination, specifically paying attention to the outlet to make sure that there is nothing inside that valve outlet. And you want to take a look at the relief device, the pressure relief device, commonly called a safety. Is it the appropriate safety for that cylinder's service pressure? We're checking residual. Remember, there is no residual gas when we are filling compressed medical gases. We will open the valve and we will do an odor test to make sure that there is no odor to each and every cylinder before it is hooked up to the filling rack. Once the odor test is done, the valve is opened and the residual product is expelled to the atmosphere. We check the label. We're checking to make sure that the label is clean, the label is not obliterated, and it is of the current iteration. Packaging and label control. The FDA labeling regulations defines a manufacturer as a person filling gaseous drugs into dispensing containers. To be considered a manufacturer, the medical gases must be filled by individuals employed by the company, on premises owned or leased by the company, and on equipment owned or leased by the company. The name of the manufacturer and the distributor, whether it's a corporation, a division, or doing business as, and any other qualifying phrases. The address, this is the full address, city and state and zip. The legend, which is the prescription, must now have RX only or R little x only. It was, caution, federal law prohibits dispensing without prescription. And any other exemptions or revisions. Remember when we were talking about exemptions to the labeling requirements, I mentioned that some containers, like little vials from the pharmaceutical industry, are too small to have all of the labeling requirements on a container. So there is an exception to that, and they are allowed, the manufacturer is allowed to print a page, but that page must accompany that vial in its shipping container. There are some DOT regulatory issues as to what needs to be on the label. DOT requires the UN number. UN 1070 for oxygen. They have their own specific general labeling requirements where the size and placement of the diamond and the specification as to how big the label can be, the markings and the placards. There is a CGA, Compressed Gas Association, guidance document. It's document C-7. It gives you the proper shipping name, the hazard class, the UN number, and the hazards, precautions, and first aid statements that are allowable for a DOT acceptable label. Materials examination and usage. Written procedures for receiving and storing labels and tags. We have written procedures that tell us exactly how to receive a shipment of labels from the manufacturer, what processes and procedures we need to go through to be able to accept those for use. We document the receipt of a new shipment of labels. We could use the cut labeling, which would mean instead of a roll, you would have individual labels, but that has to be 100% examined. Each and every label has to be examined. We buy our labels on a roll, typically 500 to a roll. If the first label is good, you can be assured that the 500th label will be good. Your label control area has to be secured and it has to have limited access. You need to have a label cabinet that is lockable, and QCU members are the ones that are authorized to enter into that cabinet because they are the ones that are authorized to distribute the labels to the processors. There's a whole procedure on labeling issuance. It is under strict control. It is in a locked cabinet. Labels that are not being used, or at the end of the day, labels need to be returned to a locked cabinet. Qualified individuals, QCU members, are the ones that are qualified to enter into that cabinet and distribute the issuance of labels. Written procedures for the issuance, the use, the returns, and the reconciliation. Documentation for the same. We have to not only have our written procedures of how we're going to issue the labels, we have to be able to document how many were issued, how many were returned, how many are left in the cabinet, loose labels. If a driver takes out labels because he or she is anticipating filling a liquid dewar or a liquid oxygen reservoir, and he's not sure that that has an appropriate label on it, he needs to have a label or two issued to him, and at the end of the day when he returns, he would go through the same process as the oxygen processor or the nitrogen processor. He would have to return that label to the QCU person. It would be documented as being returned. If he used it, it will be on the delivery ticket, noted that it had been used. We use a lot numbering identification on all high pressure cylinders. We use a lot number identification on all cryogenic containers. We will use a lot number on the vessel that is filled at a patient's residence or a doctor's office. It is not required by the Food and Drug Administration, but Hellgate Gas Products does require a lot number. Again, the lot number is just a code that gives you the complete manufacturing history of that drug product. Tamper-resistant packaging does not apply to compressed medical gases. It applies to over-the-counter drugs. Drug product inspection, 100% examination of the finished drug product for proper labeling, proper documentation, proper identification. Expiration dating does not apply to compressed medical gases at this time. It does apply to pharmaceuticals. As you can see, the CGA did a study and they sent a petition to exempt medical gases from expiration dating. It was denied because the FDA was concerned about leakage issues. They were concerned about aluminum cylinders. Determined by stability testing, what does the future hold? Well, the future held that the FDA finally relented and recognized that a compressed medical gas does not have an expiration date. Stability testing, that deals more with the pharmaceutical. It doesn't do anything for the compressed medical gases. They were concerned with the containers, the closures, the integrity as far as leaks, but again, they are not pushing that at this point. Labeling records, again, we're going to show the identity, the quantity, the supplier lot number, or a print run if they have it, and the date of receipt. We will have a record of the incoming inspections. We will document, the QCU member will document when he receives a new label shipment from the manufacturer that he has done the inspection, that the labels do match the labels that are in the Standard Operating Procedures Manual, the master label, and that he has found that they can be released for use. Our inventory records are our daily label control logs. Next, we're going to look at policies and procedures. Thou shall, and here's how. Production and process controls, written procedures, and deviations. Standard operating procedures must be approved and followed. The work must be documented as it is performed. We'll take a second here. During the filling process, whether you're filling oxygen, nitrogen, nitrous oxide, liquid, or gaseous, there are fill logs that we must use. Each one of the fill logs shows the step-by-step of what needs to be accomplished in order to ensure that all steps are completed. The pre-fill, the filling, the post-fill, the testing, and the release. Each of these steps must be documented as they are performed. Changes or deviations from the standard operating procedures, they must be approved by the Compliance Committee and the Director of Compliance before they are implemented. This ensures that everyone is working from the same book, doing the same thing, so we have reproducibility of all of our assays, all of our production techniques. Preparation and approval review of standard operating procedures assures uniformity. There is a written procedure for the preparation of procedures, how we go about reviewing, renewing, or adding procedures to our standard operating procedure manual. The master production and control records includes the full description of each drug product, including the name and the strength, the net quantity, again, the liters, gallons, cubic feet, container closure description, sampling and test procedures, specifications. There is no requirement in the compressed medical gas to do a theoretical yield and the limits. The label description, which is your master label, reference to manufacturer's instructions. Again, we want to take caution with that because some of the instructions from the manufacturers we have modified and made a little stricter. For example, I use the example of the Servomex calibration. Servomex says that you only need to zero your Servomex unit once a week. We zero and span every day that we would be producing a compressed medical gas drug product. We will also zero and span if the temperature increases or decreases by 15 degrees from the last calibration. Container content: assure 100% of the established or labeled amount. That labeled amount is found on our lot codes. It is the liter statement. We accomplish this by using a calibrated thermometer attached to a cylinder during the cylinder filling process, using the temperature pressure fill charts during and after the fill to ensure that at 70 degrees the stated pressure is correct, which means that the stated volume or contents will also be correct. Liquids: we fill our liquid cylinders by using scales during and after the fill. It is both an FDA and DOT requirement. This ensures that we fill the cylinder to the proper weight and that at the end of the fill, the stated contents are properly documented. We also fill vans. Those are filled by filling to the full tricock. There is a calculation of yield. We, as a compressed medical gas manufacturer, are exempt from the calculation of yield. There were draft guidelines proposed to reinstitute the requirement, but that has since fallen to the wayside. Our equipment identification: we need to identify the storage tanks, making sure that the oxygen tank is labeled oxygen, the nitrogen tank nitrogen, etc. The supply cylinder ID: if your vendor is using the ID system, Praxair does, they assign an ID number to that vessel. The piping and the manifold, they should be marked as well: incoming, vacuum, etc. Sampling and testing of in-process materials and drug products. In-process checks: as we are filling cylinders, because of the heat of compression on high-pressure cylinders, we can check to see if that cylinder is receiving the drug gas. If a cylinder is warmer to the touch than ambient temperature, we can be sure that it is receiving product. If it is colder or as cold as ambient temperature, then there may be an issue with that cylinder. May not always be an issue, because if that cylinder was full when received from the customer and we blew it down, the sudden release of gas from the container will cause the container to chill. We also at this time do the leak check. It is the first leak check that we do. It's usually done around 1500 psi, and we are checking the neck and we are checking the safety. We are also checking the stem and bonnet nut. We do this because this is the only time that we could test for a leak from the stem. As the stem is open or the valve is open, there's pressure pushing there. We can check if that stem is leaking. The purpose is to ensure that when we are finished filling the cylinders and we do our second leak check, that there are no leaks, the cylinders are good, and they can be distributed once they are released by the QCU person. Time limitation on production, purging or evacuating the cylinder. How long do you wait? Well, we don't have a time for how long we wait. We have an amount. We need to get to a negative 25 inches of mercury in our evacuation before we begin the filling process. There was at one time what they called a 10-minute rule. Predominantly, it was a filler's safety issue so that cylinders did not fill too rapidly. You didn't want a small rack of cylinders, say 12 cylinders, filling so fast that you couldn't get an accurate temperature reading from the side of the cylinder. Could also impact overfilling the cylinder. The next two sections, 113, 115, part 211, do not apply to compressed medical gas manufacturing facilities. In liquid filling, there are basically three types. There is a vehicle-mounted vessel, which is commonly called a VMV. There are large cryogenic vessels, which are commonly called LCV. And then there are nitrogen dewars. This is just a picture of one type of nitrogen dewar. If you notice up on top, on the right-hand side, this particular dewar is an open-top dewar. It has 6 stainless steel fingers that go inside that hold the samples for cryogenic storage. There are open-top dewars. The one on the left is a closed-top dewar. There are also dewars that have dispensing devices. High pressure gas filling, liquid to gas filling. All of our products come in a liquid form. CO2 is a liquid under pressure. Oxygen and nitrogen are cryogenics. They are liquids. Nitrous oxide is a liquid. If we were to be filling USP grade helium, for example, most USP helium is filled from a gas to a gas, from a gas storage, whether it be a tube trailer, to gas cylinders. Final product testing. Testing and release for distribution. Prior to release, appropriate laboratory determinations of conformance to final specs. Our specifications again for oxygen, nitrogen, nitrous oxide, 99.5 or greater. That's our acceptance criteria. Products failing to meet the specifications shall be rejected. If they don't meet the specifications for assay or odor, if they don't meet them for assay, they would become out of specification. We've already discussed the processes and procedures of that. If they don't pass the out of spec retesting, then they would be rejected and an investigation would ensue. Vehicle mounted vessels, when we check the vessel, we want to make sure that it has some pressure in it. That's a verification that it's not a totally empty vessel. We're going to fill it from our properly qualified supply, which is our USP grade oxygen. The leak check, because this is a cryogenic going to a cryogenic, we're not able to do the spray check. We are able to listen for abnormal sounds. We will do the ID and assay testing. We do not do the CO testing for nitrogen at this time. The FDA has eliminated that requirement on nitrogen now. On cryogenic home vessels filled by home care companies, there is no additional analytical testing required, provided only liquid oxygen is filled on the premises, provided that the vessel is dedicated to home care oxygen use, and also provided that the vessel has not been empty or out of service. A vessel that has been empty is one that has no liquid and its pressure is below 15 psi. Otherwise, they need to do the ID test if the vessel has been empty or out of service, or if the vessel has been new, or if the vessel has been repaired or maintenance was required. If the vessel was potentially subjected to contamination or a foreign product, i.e. nitrogen in an oxygen vessel, full USP compendium test will be required. Most of the times when a home care company has an issue, they will remove that vessel from the patient's home and replace it with a vessel that they know is good. Hellgate gas products filled cryogenic nitrogen dewars. There's no analytical testing that can be performed. We've filled the D55 or the GP45 liquid nitrogen vessel in the plant. The vessel has a COA attached to it, and it is properly labeled. On high pressure cylinders, each cylinder will go through a final leak test. This leak test is done off of the manifold so that you can check the neck of the cylinder, the safety, and the outlet. It is a total waste of time to try to check for a leak coming from the stem of the valve. There's no pressure behind it, so therefore it will not leak. One cylinder per lot of an uninterrupted filling cycle will be tested, and that cylinder will represent the entire lot. It will be tested for the ID, odor, and assay. The one cylinder per day from each pressure fill check, we do not have to do that. It used to be a DOT requirement. It is no longer a DOT requirement. The settled temperature pressure check. Let's take a look at filling records. Batch production and control records. Records prepared for each lot, whether it be a large or home cryogenic vessel, a fill, or a manifold fill. We will document all significant steps as they are performed. The pre-fill, the fill, the post-fill, the post-fill inspections, and the tests. There will be dated signatures from the filler and the reviewer, or if they have an analyst where one guy fills, the next guy analyzes, there would be two names on the fill line. Significant steps include identity of the equipment used, identity of all components, in-process test results, documentation of area inspections, samples of all labeling, how to comply, description of drug product container enclosure, identification of all persons engaged in manufacturing that are performing these operations. If you have two people assigned to a manifold and they are doing different tasks, each person must sign that production fill log. Laboratory and test records. It's a record of complete data, description of the sample, statement of the method, the validation data, calibration results, as found, as left, with comparison to specs. This looks at our Servomex. Test results obtained with comparison to specs, the identification of the analyst, and the identification of the reviewer. Our record review. Record review is a two-party review. It's by a qualified person, which would be your QCU member. It's never done by the person performing the operations. And the reason for that is quite simply, nobody wants to fail their own work or admit that they made an error. Discrepancies or items not meeting specifications, we will investigate those, and they must be corrected and documented and explained. Prior to release of product, there should be a physical review of all containers for proper labeling. Conducted prior to distribution. It may be acceptable to conduct by the end of the following business day, and we have that statement because there are some facilities that may be running 2 shifts. Or maybe a driver did not get in before the QCU member went home. So by stating that we can conduct our review by the close of business the next day allows us to review those records. Warehousing and distribution. Warehousing procedures. We need to have quarantine areas for cylinders that need repair, for cylinders that are out of test, for cylinders that need cleaning. Storage conditions. The temperature, humidity, and light are not critical to compressed medical gases. Lighting is critical to the manufacturing process. We may need to consider other environmental elements. Right now, the Food and Drug Administration is taking a look at those. There is nothing yet on guidance. Gases other than oxygen. There may be a requirement in the future where nitrous oxide may be required to be in a cage with very limited access. Some manufacturers have already gone to this point. Um, Airgas has gone to this point where they have caged an area and all nitrous cylinders are removed from the vehicles nightly and put in the caged area, and just the QCU members have keys to that area. It is a locked area. We have not gone that far yet. We are waiting for the guidance. What Hellgate Gas Products and Hellgate Gas Products customers should be doing: supplier filled and labeled high pressure cylinders and liquid containers. Verify the labeling is appropriate. When we receive cylinders in from our spec gas manufacturer, we need to make sure that we are looking at the labels and making sure that they are not obliterated. Making sure that the cylinders that have or are supposed to have COAs do in fact have the COAs. Document the lot number of cylinders received into inventory. We use that documentation for any recall practices. We document the lot numbers being distributed on our delivery tickets. And we will have and do have complaint and recall procedures written and established. Distribution procedures. We should always practice FIFO, first in, first out. This ensures that the oldest lot code will be fairly recent. What we don't want to have is we don't want to have cylinders sitting on the floor that were filled last year or the year before because everybody is pulling from the front of the pile instead of rotating our stock. Our recall system is a combination of paper and computer. Our paper trail is our delivery tickets, and the computer would be able to determine who got that product. We need to be able to trace back to who got that product. For example, we fill oxygen cylinders for a DME company. So if we had to do a recall, we would notify the DME company. The DME company then would have to look through their records to see who they ultimately distributed the product to. That's your traceability. It also goes the other way. If we end up in a recall, we can look back at our manufacturer and through the lot code system find out what the specifications were on the incoming bulk product that we received. Distribution records include the shippers, the delivery tickets, bills of lading. The lot distribution records is the name of the product, the dosage form, which is the size of the cylinder, the name and address of the consignee, the date shipped, the quantity shipped, and the lot numbered. It is a requirement. There are additional standard operating procedures and record-keeping requirements in section or in part 205.5 F and G. Returned drug products. Identified and held. Control is an issue. There is an SOP required. If it is done, it is not a normal practice for high pressure medical gases. Remember earlier I stated that we do the ring test. We vent all of the medical gas high pressure cylinders and we evacuate them. So we do not have a return drug product. I also mentioned previous that if a customer wants to return a full cylinder, we cannot issue credit for that full compressed medical gas cylinder because it has been out of our control. We don't know whether he had it filled somewhere else after he had gotten it from us. We have no way of knowing anything about that cylinder or the integrity of the product that's in it. Therefore, there is no credit for returned drug product gases. Drug product salvaging for product involved in fire or other disasters. Again, it is not a normal practice for medical gases. If we were to do it, we would have to develop a standard operating practice or procedure, and it's much easier not to worry about that. It's much easier just to vent the product, evacuate the cylinder, and continue with the filling process. Some of the other records and procedures that we have as a compressed medical gas manufacturer. There are some general requirements as to record retention. Records must be maintained for 3 years plus your current year. So if this is the year 2015, you would have to maintain records for 2012, 2013, 2014, and this current year. The records have to be available for inspection. Have a system where you can put your hands on your production logs, your training logs, your maintenance logs, your calibration logs. There is an annual drug product review. Internal audits. As a company, we will be reinstituting internal audits. This is not to point fingers. This is to ensure that everybody understands the SOPs and everybody is following the SOPs. We discussed earlier about the FDA inspections and notifications. Management communication. If you have an FDA or a state inspection, notify the director of compliance, notify the owner of the company, and take their direction. They will communicate to you what you can and cannot do. Complaint files we discussed a little earlier. It says not previously discussed, but we did. Complaint files, there are written procedures for written and oral complaints. You may receive a letter stating that there was an issue with a product, or you may just get a phone call. You need to document the complaint, and the documentation includes the product name, the lot number, that's extremely important, the complainant name, the nature of the complaint. The cylinder valve couldn't be opened. Cylinder was only half full. And then the reply to the complainant. The reply is the results of your investigation. This is what we found, Mr. Customer. Yes, the valve was hard to open. The cylinder has been pulled from service. The valve will be replaced. We will be issuing you a credit for this contents of this gas. So we have the written record of investigation. What did we determine was the root cause? What was the root cause for the complaint? Were we not following our procedures? Or was the root cause the cylinder developed a leak after it had been reviewed and released? This is not typical on steel cylinders, but it could happen on aluminum cylinders. Other things that we may find is we may find if a customer is complaining that they can't open the valve, we may find that that valve was already opened as far as it could possibly be. They were trying to use an empty cylinder. They make mistakes just as well as we do. We have to be cordial about explaining that mistake so they understand. A QCU unit member will review the written record, the entire record, for completeness. The complaint will be closed. A copy of the complaint will be sent to the home office. If the complaint is serious enough, it may require reporting it to the FDA. There may even be there is a proposed rule out, it's not there yet, to report it to SADR, which is a safety reporting. This is the end of the current good manufacturing practices training module. There was an awful lot of information that was discussed. I hope that I have made things a little clearer and helped you to understand a little better about the guidelines that we must follow as a compressed medical gas manufacturing facility. I thank you for your attention. Have a great day.